зміниться доля, згинуть наші вороженьки, як роса на сонці. Запануєм і ми, браття, у своїй сторонці. Душу й тіло ми положим за нашу свободу і покажем, що ми, браття, козацького роду.
Дякуємо дуже. Ксенія, ну і тепер я пропоную нам з вами вже вийти, тепер підійнятися на сцену і сказати декілька слів всім присутнім людям. Я впевнений, що і нам є що сказати, і всі... Навушників немає. Так. Звичайно, як вам зручніше?
Якось ближче.
Dear friends, you know, I would like to say a speech to our conference. I thought a lot what to think, and today at 6 a.m. it came to my mind, and thanks to everybody today, I think that the air raid siren of 4 hours helped it to me. So there is an analogy. The war in Ukraine for the 9th year. The last year was very difficult. It's very aggressive, horrible, and tragic one. The same sequences we may have later on. Very difficult, chronic, and aggressive. It's necessary to train everybody who is at war, to provide some skills. So we're here, the experts have to train every day and to build up our strengths as our service at the front line. We need the weapons at the front line. It shall be quality and different one. And we as experts need these weapons as well. A lot of and different one. We have to get it. Because the people who are defending us nowadays, they are providing a colossal and very important job for us. And the task of all of us is to give the same feedback to them when they return. So we learn, we will be weaponized, and let's go to our victory. So let's start and wish you good knowledge. Go ahead, please. Thank you so much. And some more greeting words before we start our event. And now I would like to invite a guy who is cooperating with the Forest Glade. This is Ukraine Association is Psychedelic Research. Oleg Orlov, take the floor. Just to be closer to you. Greetings to all the participants to this association. We are an NGO. We are combined with the same goal. It combines researchers, experts in healthcare, and social activists. As an organization, we plan to be trying to discuss the psychedelic situation in Ukraine, and we are very glad to have this meeting today here for this task. And I would like to ask, first of all, to the armed forces of Ukraine who are defending our Ukraine. Otherwise, we will not be able to sit here, and there will be no future Ukraine at all. Also, thank you to our organizers and to our partners, those who take care of Ukraine and who are supporting Ukraine in organization and financial side. And thank you to volunteers from UPRA for your work to make this setting comfortable. So wish us all a fruitful event and hope it will start a public discussion. Thank you for your attention. So we told we with you. It's our international conference. There will be a lot of speeches. And now I would like to come to the floor who are the friends of Ukraine and who support Ukraine, who are here, who have directly joined the creation of this event.
Тож я б хотіла надати слово людям, які є друзями в Україні. Елізабет Еймс, керівниця першої групи волонтерів корпусу миру в Україні. Ця засновниця благодійної організації Heal Ukraine Chaban. Це привілегія бути тут, підтримувати цю історичну конференцію в Києві для України. Моя повага та вітання від імені всього суспільства Америки та всього світу. Та більш за все, я несу підтримку та любов американського народу до України, до її сміливості, до її духу та натхнення, яке ви даєте американському народу. Дякую та чудової вам конференції.
Thank you so much. Before I enter this hall, I saw such a warm hug to one of the participants, and it was so touching and so warm and so nice. It was like, it was like a symbol of what we are going to do here. Thank you so much. So, okay, and one more word to one of our friends. This is the founder of Borderlands, Sam Cook.
My last job in the United States Army was teaching Russian history at West Point, but my master's thesis was on Ukraine. In fact, in 2010, I wrote my thesis on Crimea and said this might become a problem in the future. I don't want to say I was good at predicting the future, but I am proud because historians are really just good at looking back and explaining what happened. And after I left the Army, 13 years of service, 2 tours in Iraq, I decided to move to Poland at the time because that was when the Revolution of Dignity was happening, and decided to move to Ukraine in 2018, and I've lived here ever since, live here in Kiev with my wife. And when the war started, my old training, my old background as a historian, military officer kicked in, and I founded the Borderlands Foundation, and our mission is to help Ukrainian heroes, the veterans, the fighters, tell their stories for the historical record, so that history records everything that they've done on the battlefield, and we never forget, we learn from, become stronger in Ukraine, but also the Western world, which is supporting Ukraine. And the Borderlands Foundation, that's our policy think tank side of things, is the historical record. We help journalists who inside the country get access. We help analysts who come into the country also get access so that they can tell the story of the war to inform the victory. The other thing we want to do is, my own personal journey was, after I left service, I didn't talk about my service, I didn't talk about my war experiences, until I went through my own personal psychedelic experiences. And that really unlocked in me a huge, evolution in my life. So I'm very passionate about what psychedelics did for me personally, not afraid to talk about it in public, and want to make it so that every veteran is not afraid to experience if it's right for them, and talk about it in public in the future, because that, I think, is going to create a true strengthen Ukrainian society to help bring us through this during and after the war. So it's a privilege to help organize in some small way this event. I look forward to being a part of this community for many years to come. Thank you.
Thank you. Що ж, друзі, власне кажучи, тепер ми вже...
So, friends, now I can say we are ready to start. Let's check our watches and let's get set for the time. We will have 3 steps of our conference. The first step will be for the international experience. There will be 5 speeches from 5 different countries. Afterward, there will be a small break, and then we will have lunch to have an in-person discussion to get some context Ksenia was talking about. And later on, we will have a panel discussions with 6 veterans who will share their own experience in treatment, psychedelic-assisted therapy. And after that, our experts, specialists, will share what they think, what the current status of psychedelic therapy in Ukraine is. And then there will be a wrap-up summary. Now we are having 10:25. We have to start at 10:30 because our first speaker will join us, Dr. David Nutt. It's the so-called legend in the pharmacology world, so we will not be late because his speech will be for 30 minutes, and I listened to his speech 2 weeks ago, and I know this person has a lot to say, but now I want to let David know because we wanted him to have a speech for 20 minutes like TikTok, and then 10 minutes to be left for a discussion so that you can and questions. So having said that, I have one more very interesting and pleasant news. So we were talking about international experience, and we are really supported by the whole world. We have received a lot of video messages from the different famous people in the field of psychedelic research, like Doblin, the Carhart-Harris. We have combined all these greetings into one video, but they will be step by step to see that assistance is everywhere. And now I would like to demonstrate you the first part just for some minutes.
Hello, it's my honor and pleasure to
Всіх вітаю. Для мене велика честь і радість говорити до всіх вас у госпіталі для військових від нашої асоціації досліджень. Я маю ступінь доктора філософії, і я вивчаю психоделічну терапію. Я почав вивчати в 1976 році вплив психоделіків через рік після того, як їх зробили кримінальними, як їх зробили поза законом в 1985-му. Але в нас були неймовірні досягнення у цьому виді терапії. І ми були готові подати до FDA здобутки нашої праці, але тепер ми чекаємо на результати цих висновків.
provide MDMA-assisted therapy to people who have been traumatized by this horrible war, either inside Ukraine or outside Ukraine. In both an amazing development, I was contacted personally by Mark Brzezinski, who is the U.S. ambassador to Poland, and he wants a briefing on MDMA-assisted therapy for the possible use with Ukrainian refugees with PTSD in Poland. That briefing is going to take place around the same day as your conference. We are deeply involved with the Veterans Administration, and we have treated a lot of vets, and we are in about 7 different Veterans Administrations around the country to test various things related to MDMA-assisted therapy, comparing it to other therapies, combining it with other therapies. We have our own treatment manual and our own therapeutic approach, which we call inner-directed therapy. We are trying to start research inside a Department of Defense facility at the Naval Medical Center in San Diego. I do a grand rounds there on May 26th. There have been many people who have benefited from MDMA-assisted therapy. We had someone actually in our study from Vietnam who had PTSD for almost 50 years and was still able to get better. So MDMA-assisted therapy for PTSD is indeed one of the most effective approaches to treat PTSD. And we would like to facilitate however we can the training of Ukrainian therapists, bringing this into Ukraine. There's a team, Eric Vermetten, who was the chief psychiatrist for the Dutch Ministry of Defense, who is wanting to work with Ukrainian refugees with PTSD in the Netherlands. The person that did our Israeli study initially, the principal investigator, was the chief psychiatrist for the Israeli Defense Forces. I should add that roughly 2/3 of the people in our studies are women with sexual abuse and PTSD from that. The veterans tend to get the most media attention, but I'm sure you have terrible PTSD from all sorts of causes. And so we really think that this can play a role in helping deal with the mental health problems that you're facing in Ukraine, and we would love to do whatever we can to help. Slava Ukraine. Your fight is our fight.
Дякуємо дуже. Таких слів підтримки сьогодні ми почуємо дуже багато. Ну, а власне кажучи, зараз ми вже переходимо до першої частини. Як я і сказав, ми будемо ділитися міжнародним досвідом. Зараз з нами буде на зв'язку професор нейропсихофармакології та директор лабораторії нейропсихофармакології у відділі наук про мозок Імперського коледжу Лондона.
David Nutt, professor of neuropsychopharmacology and director of the Neuropsychopharmacology Laboratory, the Department of Brain Sciences at Imperial College London.
Nice to hear you. So we're about to start. Insofar as you know, we got 30 minutes, but I've been listening to you for hours.
Я вас слухав дуже багато разів, і я знаю, що ви можете багато що сказати. Можна ли би ви сказали на 10 хвилин сесію?
Yes, that is fine.
Так, це прекрасно.
Begin.
Well, it's good to be talking to you, and I guess this is a particularly appropriate day given the attacks on you last night. And you know, my thoughts are with you. It's a horrible situation you're in, and let's hope we can do something with psychedelics and MDMA to facilitate recovery of your peoples who are going to be traumatized. So what I want to do is just give you a very brief overview of what psychedelics are, what MDMA is, but more importantly, why they are coming to the fore as treatments for trauma disorders. The modern sense of psychedelics really began with the discovery of LSD in the 1940s by this man, Albert Hofmann, and it came into wide use as a product called Delicid. And Hofmann also discovered subsequently the active ingredient of magic mushrooms, which was psilocybin, and Sandoz also made this available as a medicine. And back in the 50s and 60s, there was a huge amount of research, 1,000 clinical papers published in 40,000 patients, 40 books, an enormous amount of research was done. And here's a summary of the top papers from the leading psychiatrists at the time. Treatment with LSD is not without acute adverse reactions. These drugs do have powerful effects on the mind, but given adequate psychiatric supervision and proper conditions for its administration, the incidence of such reactions is not great. So we have here a breakthrough in the treatment of a range of different mental disorders. But of course, it was another war, the war in Vietnam, that brought all this to an end. And the top left-hand figure here, you see the cataclysmic effect that the UN psychotropic conventions had on research with these drugs. Here's a number of papers per year up to the ban, and here are the number of papers per year after the ban. And this ban was occasioned by the association that was made between the use of psychedelics and the anti-war movement. And that was something that challenged the American war in Vietnam. They couldn't ban the protesters, but they could ban the use of LSD or acid. And this was truly a horrific impediment to research. And this is the worst censorship of research, the lost opportunities in the last 50 years, simply due to an attempt to stop anti-war protesters. But it's come back, and it's come back because of war, and it's come back initially in the shape of MDMA. You know, MDMA was discovered and popularized in the 1980s and 90s. And initially it was seen as a recreational drug that people wanted to ban. But then after the Iraq and the Afghanistan wars, with the trauma of soldiers and also the trauma of civilians, it was been resurrected as a therapy. And you heard already this morning, Rick Doblin talking about his pioneering campaign to keep MDMA functioning as a medicine. One of the reasons for this resurrection of interest in psychedelics and MDMA is a number of expert groups, and here are their data, have used modern methodology to explore the true harms of these drugs in comparison with other drugs such as alcohol and tobacco and morphine. And they've all, using different experts groups, have all come to the same conclusion that within the red circles here, you have LSD, MDMA, and psilocybin, and they're all scored very low in the scale of harms. And so that has proven the original claim in the UN conventions that these drugs are very dangerous to be false. So we've seen that they were medically useful, which was also denied by the UN. We've now here seen that they're not harmful. And that, therefore, there is no justification for keeping them controlled under Schedule 1 of the UN conventions. And that is why people are now beginning to look to change, and particularly the Australian government, as a result of learning about this information, announced that from July the 1st this year, psilocybin will be available for treatment-resistant depression and MDMA for treatment-resistant PTSD. So this is the first country in the world to have made these drugs a medicine. And in America, we see that there's a great desire to follow suit. The MAPS MDMA study, we hope will get FDA approval soon. And the psilocybin studies, hopefully in a year or two, they will be approved. But I think it's too late. And I'm very sympathetic and supportive of the Australian approach, which is let's do it now. The evidence is sufficiently strong. Let's reschedule these drugs for human need now. Why did Australia change? Well, it looked at the data. Here's the data from our study of psilocybin in treatment-resistant depression. These are all people that had failed on at least 2 antidepressants. They'd all failed on CBT, and they all got better. Now, you might say, why is he talking about depression? We want to talk about trauma. And the really important message here is that we know that the impact of trauma on people is not just to produce PTSD. About half of people who are traumatized become depressed, and half get PTSD if they develop an illness. So it's really important to be helping people with depression occasioned by trauma. And many of the people in our study were traumatized many years ago, and the depression has persisted. So here we have the most powerful treatment, single-dose treatment for resistant depression there's ever been. And some people are well 10 years after 1 dose of psilocybin. This work has been replicated here by the group at Johns Hopkins in America, and more recently by the Compass Pathways multi-center study, different European and American countries, dose-related effect. The blue bar is a 25 milligram dose, the same is used in all of the studies. Here you've got a quarter of people with treatment-resistant depression in remission 3 months later. So this is powerful, powerful medicine. And also there is data with ayahuasca and DMT coming. Here are the MAPS phase 3, the first of their phase 3 studies that shows a powerful benefit of 3 MDMA sessions added to psychotherapy over a period of months, a much greater reduction in PTSD scores than standard psychotherapy with placebo. And on the right here, you see the outcome of this phase 3 study. The black circle, everyone had PTSD and they'd all tried other treatments first. It was treatment-resistant PTSD. You see here that after treatment with MDMA, less than a quarter still met the diagnostic criteria for PTSD. Whereas in the blue circle here, you see the ones who got placebo, 3/4 still met criteria. So this was a hugely exciting finding, very powerful outcome. If it's replicated, as I think it will be in the second trial that MAPS have done, then it's very hard to see why this could not be a medicine, because the effects are so strong. We recently conducted a small study in people who were drinking to deal with trauma, and this is a very common response. People try to deaden their emotions, deaden the memories, and we showed that in our alcohol treatment program, just 2 doses of MDMA in this phase, in the abstinent phase when they're getting psychotherapy, helped the majority stay sober up to 9 months, whereas the group without MDMA, 2/3 relapsed to drinking within 3 months. So this, again, powerful evidence that MDMA can be a useful medicine in people who are both addicted as well as traumatized. So we have clinical data, but even perhaps as important, we now have brain imaging data which tell us how these drugs work. So this is now the science of their therapy is well understood. I'll start here with MDMA. When we do brain imaging of MDMA, we see that it has a powerful effect to suppress activity in the emotional centers, the amygdala and the hippocampus. And these are the centers of the brain which are overstimulated and overactive in PTSD. PTSD is a disorder where the emotion that accompanied the trauma surges back into consciousness and becomes very disruptive. Now, we know from a range of studies that the emotional center is different to the center where you encode memory of the event. And psychotherapy is designed to help people overcome and suppress and eliminate the emotions. You want to get rid of the memory. And that's what MDMA does. It suppresses emotional reactivity and allows people to properly engage with the therapy, which is why the therapeutic outcomes of the MAP studies are so strong. Psychedelics work in a different way. Different psychedelics all stimulate serotonin receptors in the brain. And these receptors are in very high level parts of the brain, the parts of the brain where people do their thinking. They're thinking about themselves, about the past, about their traumas, about their moods, etc. These are the very highest level cognitive functions which are disturbed in trauma or by trauma. And we can show now that psychedelics, here we have psilocybin, we have LSD, and also have ketamine, produce a powerful disruption of activity in the brain. These are this image is using a technology called magnetoencephalography. It looks at the power of the different frequency ranges from slow waves to fast waves, and it shows psychedelics have this powerful effect to disrupt ongoing cortical activity. And we think this is how they disrupt thinking processes that allow people to persistently engage with those traumatic memories or those depressive thoughts. And this image shows that after a psychedelic, there is a massive increase in connectivity in the brain. And that's a hugely important outcome, because in mental illnesses, people get locked into thought processes from which they struggle to escape. And under psychedelics, you break down the constraints that drive those thought processes and allow the people to reevaluate not only their past, but also to come up with new ways of thinking about the future as a result of these increased connections. And this is a recent paper of ours which summarizes very simply what's going on. Now, we do not scan depressed people or traumatized people during the therapy, but we do scan them afterwards. And this is really what we found in depression. It's extremely exciting because it shows that during the psychedelic trip, the energy landscape of the brain becomes much more flexible, as I showed you in that previous 2 slides. In depression and trauma disorders, the brain becomes very inflexible. You have deep valleys and high mountains. And if you get trapped into a thought that's a valley of despair, for depression, for instance, it can be very difficult for people to stop having that thought. Under the psychedelic, we believe the energy landscape is flattened, both in patients as well as healthy volunteers. But when we scan the patients, either 1 day or 3 weeks after treatment, we find that the landscape is still more flat. And that accords very well with their experience of greater cognitive flexibility, a greater ability to challenge thoughts, to not be tied to the same old thoughts they had before. They say it's as if their brain has been defragged like a computer or reformatted. They become much more flexible in their thinking. And that's the increased flexibility we measure in the brain correlates extremely well with the recovery from the disorder. So I'm going to finish now by just quoting this very famous philosopher and playwright, George Bernard Shaw. Those who cannot change their minds cannot change anything. And what we have seen now through our work with psychedelics and MDMA is that these drugs change the minds of our patients. And they do that through changing their brains. And the challenge now, and of course, is what this conference is about. It's about changing the minds of healthcare professionals and politicians about these therapies. We've got to stop people, maybe educate people who were not even born when these drugs were made illegal. We've got to educate them that the ban on these drugs was a politically motivated act. It has no substance in science nor in medicine. And we've got to bring them back into clinical practice as soon as possible. And I can think of no better country in the world to initiate such a change as Ukraine, because, one is for sure, there's an awful lot of people in your country who have been traumatized by this horrible war. So I'll finish now and take questions, but before I do, I want to emphasize, I have a charity in Britain called Drug Science, and we've been gifted some funding to help young Ukrainian scientists or doctors who want to learn more about this therapy or anything else in the field of brain therapy that may be helpful. And if you know anyone who will be able to take advantage of these scholarships, put them in touch with me, because they will be able then to come to the UK and see some of the centers where this research is being done, and hopefully bring back some expertise to Ukraine so you can promote this knowledge of these therapies. So I'll stop now and take questions. Thank you.
Thank you, David. You have a perfect sense of time, of course, because it's exactly 18 or 19 minutes. We have 10 minutes left for the questions. So, друзі, у нас є змога задати Девіду Натту запитання. Я так собі уявляю, що це може бути десь 5 запитань. Така у мене інтуїція. 10 хвилин, 5 запитань. Так, щоб я собі...
На які зараз мені? In English, не? Do you have anybody who would like to have questions for David? Please raise your hands, and if you have any questions, you can address it in Ukrainian language. I will translate it with pleasure. Depends to please use this possibility and raise your hands. Who is the most courageous to ask? So you can ask questions in Ukrainian or in English. Перша.
Thank you for your wonderful presentation.
Дякую за чудову презентацію.
These drugs are often used recreational drugs? And in such cases, do they have the same medical effect, or it's important that they are done under supervision of doctor? Thank you.
Yes, so I can answer that. There are many people who are self-medicating because they cannot access these drugs in clinical situations. In fact, there are very, very many people who are using MDMA and or psychedelics in retreats in the Netherlands or in South America, some in Spain. And they're doing that because they want to sometimes overcome problems they have with their mind. And we have been collecting information from many thousands of these individuals. And that is why they're fairly confident that we have the clinical data is valid, because many of those people who are using retreats in a way for self-medication are finding they are helped in terms of their mood or in terms of their anxiety or PTSD. But we cannot be sure they're getting the best therapy. And so we strongly encourage countries to set up proper therapeutic centers. But until they do that, it's inevitable people will seek help elsewhere. And hopefully if they do that, they will in guided retreats rather than simply taking the medicine themselves or taking the drugs themselves.
Thank you very much. Друзі, у мене є пропозиція. Перед тим, як будете задавати запитання, для того, щоб ми вже знайомилися, будь ласка, представляйтеся, щоб ми потім до вас могли звертатися. Мене звати
Dear friends, if before you say the questions, please present yourself and tell my name is, and then after that your question.
Доброго дня, колеги. Мене звати Роман Ліщук. Я є лікар-психіатр.
Dear friends, my name is and I'm a doctor psychiatrist. The question to Sir David: I know that single-use therapy, 20 milliliters, will give the stable effects within 1 month. Can you guarantee that the effect will not be lost? You had research of 3 phases. Do you have any research of the positive effect without any absence of any disorders?
So there is a study that tells that one session of 25 milligrams of psilocybin gives a positive effect for a month. Then you were presenting a study about 3 sessions of psilocybin that guarantees 3 months follow-up, which tends to be positive. So are there any studies that are showing that the effect can actually be prolonged for 3, 6 months, or a year?
Yeah, great question. Look, some of the early MAPS studies with MDMA showed benefits which can last for maybe now 8 or 10 years. Some of the earliest psilocybin studies showed effects which can last in some people for many years. Our study in depression did that. But for people who've been repeatedly traumatized, the trauma memories sometimes come back. And that situation, we've got 2 options. One is to try the psychedelic again, or the other is to think about other ways of maintaining wellness. And that could be psychotherapy, or it could be other medications like SSRI or even mood stabilizers. There's still a lot of work to be done on that. But the fact we get such long-lasting changes from just a single 1 or 3 administrations is very remarkable. It is a true breakthrough in terms of medical intervention with these disorders.
Thank you very much. Сюди, будь ласка, мікрофон.
Це що, на які?
Mr. Nutt, I am Vladyslav Matrenytskyi, MD.
Ви сказали, що терапії кажете, що можна використовувати також інші психоделіки. Чи можна використовувати різні типи психоделіків протягом одного сеансу чи протягом цілої серії сеансів? Як взагалі це узгоджується? Хочеш на український? Так, на український.
Sorry, I did not hear the question.
Okay, so you were saying about the psilocybin therapy, and Vladyslav Matrenytskyi, MD from Ukraine, he's asking, are there any severe cases that need to use several of the psychedelic substances, or the psychedelic substances that are different from the psilocybin in more severe cases?
No, the evidence is very clear that the psychedelic experience from psilocybin or LSD or DMT, they're very, very similar. If you produce the same psychedelic experience, so the dosing differs, but the experience is the same. So it doesn't seem to matter which you use. No, but there are some researchers in Switzerland who sometimes use MDMA later in the course of therapy. So they may start with a psychedelic, and then if they don't get full recovery with the psychedelic, they might move on to some MDMA sessions. Now that's not properly researched, but it is a clinical experience of people like Viktor in Switzerland, that some people may need different sessions, either MDMA or a psychedelic.
Thank you very much. And we got one last question. I got the person in there. Somebody was raising their hand, and thank you. Please give the mic. Yep.
Thank you. I'm Igor Holodilo, and currently I'm acting combat medic. Do you observe any kind of differences in your therapy, PTSD therapy, which is the result of combat trauma? This is the first question. And another question, can this kind of therapy be helpful in concussion treatment?
Well, two excellent questions. So the first thing I would say is that there's not been a systematic comparison of psychedelic therapy versus MDMA therapy for trauma, military trauma. But what is remarkable, and you will hear this from other organizations, is a lot of American and British vets are now seeking psychedelic therapy because they have found that it can be remarkably effective in dealing with their trauma memories. And they often do this in group therapy, hosted by, say, a shaman. And I think that group therapy for veterans who've all been traumatized in a similar way as a result of violence and war, that could be very powerful new therapy, but it's not been systematically studied. It would be an opportunity for you in Ukraine to do that. And then the second question was about traumatic brain injury as a result of explosions. The answer is there is some work being done. We are doing this work. I am working with a Ukrainian neuroscientist in Imperial College, Andrei Kozlov, who was extremely distressed when his university was destroyed by the Russians. We're working on models of TBI in animals to see if we can facilitate recovery of TBI using non-psychedelic doses of psychedelics. So that work is going on. And as I said in my last slide, if there's anyone in Ukraine who wants to come to Britain and learn about this kind of lab-based research as well as clinical research, we do have these scholarships available. And so get in touch, because this is a very exciting prospect. In theory, psychedelics can produce a phenomenon called neuroplasticity, and that could facilitate recovery from traumatic brain injury.
Well, thank you very much, David, for your invaluable time. May we ask you, insofar as we have one last minute, to say the last word of encouragement from you before we move on?
Well, yes, it's something, you know, we feel very helpless in the West, probably not as helpless as you feel sometimes, but it's, I'm really pleased that this conference is happening. I think, you know, it's sad that you as a nation will need the help that we can offer in terms of these treatments, but please do reach out to us. Yeah, you've got my email, I will respond almost immediately. And if there's anything else I or my team and the charity Drug Science can do to help you, just reach out, because your need is much greater than ours, and we're very, very keen to support you in any way we can.
Dr. David Nutt, thank you very much.
Thank you.
And especially for that warm invitation to Great Britain, we invite David as well in here for the next follow-up sessions that we might have for sure, because this is just the beginning of the conversation. Друзі, мені дуже приємно і цінно хочеться відмітити те, що всі включилися в запитання. Я дуже хвилювався, що всі будуть сором'язливими. Все класно, давайте з вами рухатися далі. У нас з вами далі на зв'язку можливість поспілкуватися зі спеціалісткою з Ізраїлю. Це так, щоб ви точно зрозуміли, дублюється, розумієте, щоб вже точно ніхто не розгубився. Тож, з нами зараз буде на зв'язку клінічний директор проєкту Open Access у рамках МЕПС та Міністерства охорони здоров'я Ізраїлю, який надає допомогу у терапії з використанням МДМА для 5 учасників у 5 державних лікарнях Ізраїлю. Доктор Keren Tsarfati. Keren, are you with us? Can you hear us?
Yes, can you hear me?
Yeah, we can certainly hear you. So, you've just been listening to the...
На українську, так?
Him, and hopefully it's going to be suitable for you as well, that during the first 20 minutes you're going to deliver your speech, but then during the next 10 minutes we are going to open the floor for the Q&A session. Is it okay with you?
Totally.
Great.
Totally.
So let's start.
Okay. So first of all, thank you for having me. It's an honor. And I'm very glad to be part of this conference that is unique and important to my opinion. And let's start. I'm going to tell you a little bit about psychedelic-assisted psychotherapy, specifically about MDMA for PTSD. Let's see, can you see the screen?
Not yet. But
because I just shared it. So let's see if you...
Now we can see the screen.
Okay, perfect. And just a little bit about myself. I'm coming in 2 different hats today. One as MAPS US, and telling you about the results of the MDMA for PTSD study, the MDMA-assisted psychotherapy. And I'm also the founder and the CEO of MAPS Israel, and we'll tell you about the activity we have in Israel here. I want to start by just putting gratitude to spiritual traditions that brought psychedelics to the West. This is Maria Sabina, who is an elder in the Mazatec community in Mexico. I was very honored to study with one of her women in the lineage and learn about psychedelics, and that's what brought me here eventually. So just putting gratitude as we start. So I'm guessing most of you know a lot about psychedelic experiences and some of you not. So I'm just giving you a little bit of a background. When we talk about psychedelic, we talk about many different substances and doses and experiences. But in a full dose, what we always almost have is a powerful experience in consciousness. and it's characteristic by cognitive, perceptual, emotional, and sensory changes. So all the systems of the body are activated, and the experience is very intense. We're talking about cognitive, perceptual, and emotional flexibility. So we see how our patterns of thoughts and feelings and experience ourself and others and the universe are changing in a temporary way. And in neuroscience, we see also changes in the brain, more connections between parts of the brain and more activity. And we also hear about wide range of experiences. So even if I take MDMA today in a specific dose, in a specific place with a specific person, I will have one kind of experience, and it says nothing about the experience I will have maybe next week in the same day, the same time, with the same person. So I'm saying that because psychedelic experiences are a bit mysterious. We will know, we can say ahead of time about these cognitive, perceptual, emotional changes, intensity, strong experiences, but we don't know what the content will be. It's hard to predict the content. So we have to invite the participants to trust the process and surrender to whatever is going to show up, knowing that they're being held in a very safe way by the therapist. A few examples for psychedelics: MDMA, psilocybin, which you already heard about, the active ingredients of mushrooms, ketamine, LSD, ayahuasca can be here too, 5-MeO DMT. And we know that some of the psychedelics are coming from nature, like the mushrooms or ayahuasca, which is a tea from South America, and some of them are coming from the West. In research, psychedelic in research, you already know there is a huge renaissance. It's a big wave of studies in the last 10, 15 years. Some of them are looking at safety. Some of them are looking at neuroscience, the brain and the impact on the brain. And some of them, and this is the field I'm coming from, is bringing us data about psychedelic-assisted psychotherapy, treatment-resistant disorders, or for disorders, mostly psychiatric disorders, but now also physical disorders that is hard to treat. We don't have ways to treat it in a good way, so we are trying psychedelics. And some examples are psilocybin for treatment-resistant depression, psilocybin for end-of-life anxiety and depression, and the study I'm coming from, being sponsored by MAPS, MDMA for PTSD. One second, here we go. No, here. And when we're talking about MDMA-assisted psychotherapy for PTSD, about the study, we're really looking at something that, unfortunately, you're getting more and more familiar with, the post-traumatic stress disorder. Those are American data. So we know about 8% of general population, 10 to 32% of first responders, like firefighters, policemen, paramedics, people that are coming first to the event. And in the soldier population, we are seeing data of 11.2 to 17.1% of the soldiers. And I think in Israel, where I'm coming from, the percentage are higher because of the situation in the Middle East. And I think in Ukraine, it would be higher too. Having some challenges with changing the slides, let's see. Here you go. So with PTSD, we know about intense and difficult symptoms on all levels of experiences, meaning that we have psychological level that is being impacted in a very strong way: grief, pain, anger attacks, anxiety, of course, depression. That's very strong. And also somatic, subjective sensations. People with PTSD are describing lots of intensity in their body, tension, blocks, irritation, and also physical health problems. Usually after getting PTSD, we hear more and more about blood pressure issues, about heart issues. And in the spiritual, more existential level, we hear about crisis, losing hope, losing the meaning of life. So the experience of PTSD is very intense because it meets us in all levels of who we are: the psychological, somatic, physical, and existential. This is just saying a word about psychiatric medications. I'm not a doctor. My PhD is in psychology, but I want to show you this is a study that was done a while ago, but it's important one. Here we see the red line. This is a group that finished a treatment, therapy, CBT, with a drug. And here they stop the CBT. And we see that the results here that are pretty good stayed balanced, so no major change. So they stay with the medication and the therapy, and the results are still well. 6 months after they stop therapy, they also stopping the medication in the second square. And then you see the very high drop. So the symptoms are coming back. So although the combination of psychiatric medication and therapy is considered to be the best treatment approach for PTSD, we also know that PTSD treatment requires ongoing medication. Yeah. So they have to stay with the medication if they want the symptoms to stay low. And if they stop medication, then unfortunately the symptoms are coming back. So in MDMA-assisted psychotherapy for PTSD, what we were looking for is, first of all, safety, goes without saying. We also were looking, of course, for efficacy. We want the PTSD to be changed, to be transformed. We want remission. We also wanted long-term effect. So we want to see the results for a while. And we also was hoping to non-chronic treatment. So we give the MDMA in our protocol 2 or 3 times during 4 months. The patient are getting the medication only twice or 3 times. And hopefully that will be something we will see enough benefits. In terms of the pharmacological profile, so we see increase in oxytocin, in dopamine, serotonin, and it goes well, or it makes sense, with the reports of the experiences, which is well-being, insight and clarity, empathy, closeness and connection to other, love, connection. So people with PTSD, when they get MDMA, you can see that those reports are almost like a mirror experience to the difficulty we touched in the beginning. The psychological effect, the physical, somatic effects. So the experience under MDMA gives them a sense of relief and connection and safety they didn't have for a very long time, right? Of course, it's temporary, but for us as therapists, it's an opportunity to process the trauma, because when they have an experience of safety and well-being, they're regulated. They're not activated anymore in the same way they are 24/7, right, with the PTSD. And for 5 hours, pretty much, we can work with a regulated person on the trauma. So the MDMA, that's my, it's not something we checked in the study, but that's my assumption that the MDMA, because of the pharmacological profile and the therapy, which is a very, very important component, we can be with someone that is okay looking at difficult experiences because it feels safe for a while. So something we cannot do without the MDMA in the therapy. So in the world now, there are more than 1,600 participants in the clinical trials, phase 1, 2, and 3, and there are no serious adverse events that are connected to the MDMA. So the safety is pretty good. And we ask why, right? So those are some of the assumptions. The physical and the psychiatric screening is thorough. We do a lot of that. The screening and the training for the therapists are also a major
MDMA-терапія пройшла по стандарту GMP, тому дуже гарна якість самих речовин. Також 2-3 сеанси МДМА-терапії застосовуються у специфічних обставинах і умовах.
And the setting is very contained. 2 therapists, usually a man and a woman. The room is very beautiful. I will show you. They cannot leave the room. They have to drink enough. They cannot do unsafe stuff like driving, right? And you see in the last point here that there is this expression of bad trip, right? If somebody takes MDMA or any kind of psychedelics and the experience is really bad, and actually difficult and can create PTSD. But for us in the study, bad trip is not a problem. The opposite. We actually would like the trauma memory to come, and we would like to process it. We would like to hear about it when the person is under the MDMA with us in the right set and setting. So bad trip are part of the process, and it's not a problem. It's something we know how to work with. I brought you some photos from the rooms. We have two sites in Israel. One is Ber Yaakov and the other one is Sheba, two governmental hospitals. And you can see, this is the room. It's really beautiful, quiet. This is from the inside. So we have arts and plants, and we're working on creating a very warm, homey, human setting. This is the room in Sheba. Very different from regular hospital room, right? At least in Israel. Some things are happening also in Europe. So those are the places in Europe that phase 2 is running. And now I'm going to present you the result of the phase 3 clinical trial, the first part of it that we had in Israel, in Canada, and in the US, of course, total of 15 sites. And a few things I want to emphasize about the study. First, that it's MDMA-assisted therapy for severe PTSD. That's the first part of phase 3. So it's not MDMA for PTSD, but it's MDMA-assisted therapy. We are having therapy. I will show you lots of therapy before and after the MDMA experience, lots of preparation and integration. And we have, it's a randomized, double-blind, placebo-controlled study. In this study I'm presenting here, we had chronic PTSD, severe PTSD with all participants, and 50 centers, 80 therapists, and both groups received identical therapy, 42 hours of therapy by the treatment manual, and rating, clinical supervision. And of course, we had for both groups independent rater pools. So when they were assessed for their symptoms and functioning, PTSD, and so on, we tried to minimize the bias, so the raters were independent, they were not part of the therapy. Okay. This is the course of treatment. So you see the screening starts in this white circle, and then we have 3 preparatory sessions of 90 minutes each week. And after 3 weeks, they have an MDMA session for 8 hours. They stay to sleep in the hospital. The morning after, we come back, the therapist, and we have the first integration session, and then a week after another session, and a week after another session, and so on. We're coming to the second MDMA session. Again, they stay in the hospital. The morning after, we are showing up again early. 3 more integrative sessions, another MDMA session in the same format, and 3 more integration sessions that is ending the protocol. And those are the results. In the left side, you see the results of the phase 2. 68% of our population that suffered from PTSD, they don't have PTSD symptoms, and they're not considered to have PTSD according to the criteria a year after the treatment was over. So 68% a year after in phase 2, and 67-point-something% in phase 3 right after the treatment. So this is the follow-up, but we already have the results from the phase 3 that are better. So in the first part of phase 3, the 67-point-something% is happening right after the treatment. More than a third of study participants had been suffering from PTSD for more than 20 years, right? And here you can see the data. In the left side, you can see, let's go with the red line. This is the baseline where they started the study. Post session 1, you can see that the CAPS, which is the measurement for PTSD, is already much better. Post session 2, again, getting more and more improvement, and post session 3 here in the endpoint. We also looked at the functioning scale, and we see very good improvement, and also improvement in the depression. Those are the main things we study. Okay, a little bit about adverse event. We didn't have severe adverse events that are related to the MDMA, but you can see we had side effects, right? Muscle tightness, nausea, feeling cold, vision blurred. So you can see the comparison between the MDMA group to the placebo. So you see the differences. Of course, 63% muscle tightness, 11% in the placebo. But I'm very, very happy to show you that with the suicidality, we had 7% in the MDMA and 11% in the placebo, right? So we know it's not related to the MDMA. And with the heart stuff, cardiovascular, 0% in the MDMA and 2% in the placebo. So we are happy about the safety. And we now ended the second part of phase 3. I don't have the results yet to share. We're now working on the on publication. But here you can see the risk evaluation that is required by the FDA. And what we want to do is that's our hope, that post-approval, in terms of risk, only prescribed, the MDMA will be only prescribed by certified therapists that were trained by us. We have training educational program, only administered in certified clinic, and very much putting an emphasis on the safety of the screening process and working on direct connection between the manufacturer to clinic, so we keep the GMP. This is the vision for Israel. We would like eventually to go to a place where we have psychedelic therapy centers for people that suffer from PTSD and for people later on after psilocybin is being approved also for depression, addiction, eating disorder. We work very closely with the Ministry of Health in Israel, and here this is MAPS team in the Ministry of Health. After getting approval for a few of our projects, we work with many governmental hospitals in Israel, Sheba, Ichilov, Rambam, those are main hospitals and universities. And those are studies that are in the way, MDMA for complex PTSD, people that suffer from chronic PTSD in childhood, early childhood, in 5 hospitals in Israel. Psilocybin, always with therapy, psilocybin-assisted therapy for treatment-resistant depression, MDMA-assisted therapy for PTSD, moral injury. We work with an elite unit that work under custom in the occupied territories, and they suffer from moral injury, MDMA-assisted therapy for eating disorders, psilocybin-assisted therapy for addiction, and more. We also have a study for healthy volunteer psychotherapists, because we think it's really important that our psychotherapists in the studies, in the future legality, will go through the experience of the psychedelic session. So we offer that in a study for them. We also work on some physical stuff, psilocybin for assisted therapy for cluster headaches, and psilocybin assisted therapy for inflammatory bowel disease, chronic Crohn and colitis. And we also have, that's my last slide, therapist educational program, and we're actually working on offering one in August for Ukraine therapists, and you can be in touch about that with Oleg. You're very invited. We're looking for people with a clinical degree and experience in treatment PTSD in order to help Ukraine, hopefully after the war would be over or sooner, depends on your wish. But I want to echo what David Nutt said, that I think it's such an honor to have him here with us, that me and my team are very much here for you in any way that we can support you in this very difficult experience you're going through.
Thank you for your support, Keren. And we are about to start our Q&A session. Друзі, якщо можна зараз зробити світло в зал для того, щоб я побачив кількість робочих.
Can you please put electricity on to see how many volunteers for questions? So I see one and one hand over here. Can we ask somebody from this side to see how many people? So.
Hello, I'm George, psychotherapist. I'm interested to know what kind of psychotherapeutic approach do you use in a company or assessment of MDMA therapy to help incorporate the effects? Thank you.
So we have a psychotherapy manual, and it's actually very inclusive. You can use many different approaches and integrate them into the protocol. Personally, my main approach that I'm using is a COMI psychotherapy, which is a body-oriented, mindfulness-based psychodynamic approach. And I think that something that is very helpful to integrate into the therapy is mindfulness-based or somatic-oriented experiential approach, because what we invite participants to do is to be with their inner experience and just creating space for the inner experience, and then the process is happening by itself. We call it organicity or inner healing intelligence. So we need our therapists to know how to invite people to be in connection with, mindful connection with their inner experience.
Thank you very much. Бачив, ви там далі підняту руку, пане, да, будь ласка. Дякуємо.
Hello, my name is Andrew. I am a psychologist, and thank you for your presentation. So, as I know, the most studies done on psychedelics are done on treatment-resistant kinds of disorders, say depression or PTSD. What do you think about those disorders in low severity, maybe mild depression, mild PTSD? Are they more beneficial from psychedelics than the drugs that are currently described to those people who are suffering them? Thank you.
We don't have much data. I would say that in the second phase 3, that we don't have the results yet to share, we did ask and change the protocol that it included moderate PTSD. So the symptoms were less strong, so we could include that, and I can say that the results were very positive. So we have a clue that those kind of therapists may work very well also with less severe disorders, and we also have trials that are on healthy volunteers, and we hear very good reports from those studies too, not necessarily by MAPS, but all over the field, and it seems that the experiences are having some transformation potential that is very deep, also for people that are not so wounded. So I'm optimistic, but we have to have more studies in order to get clinical data.
Thank you.
Дякуємо дуже.
Thank you so much, friends. We still have a chance to get to questions. Let's see who wants to be so wonderful. One more question.
У мене таке питання. Чи є у вас досвід роботи і якась статистика, якщо мова йде не про травму, яка відбулася недавно, а про стару травму, бо бувають випадки, коли спогади в людини заблоковані, травма впливає на життя, а людина навіть не усвідомлює, що в неї є така травма.
So the question is, do you have any knowledge about the trauma that is not a recent trauma, but a trauma from a deep, deep past that is blocked for a while and keeps on popping up in different situations?
Yeah, so my answer won't be from a clinical data answer, but just as my experience as a therapist in the study, because we don't have yet the analysis of which kind of trauma is in relationship to the results. But I can tell you that in many cases that I treated, there was an index trauma. So let's say a soldier came from the army and said, I'm in PTSD since this event in the army when I was 21. But when we did the work with him, we discovered that there is an earlier trauma from childhood, sexual abuse or physical abuse. And we walked through those early traumas that were present through our life, but did not develop to PTSD before the last event in the army. Our coming study is going to be on complex PTSD. That's in relationship to MAPS Israel. So we have 5 sites, 5 hospitals, in which we are going to see people with early trauma and see if we have differences in the results.
Дякуємо дуже. Keren, thank you very much. And we got one last question for you before we move on. Please.
Shalom, and thank you for such scientific, profound, and deep investigations, especially, I mean, the double-blind, random controlled things, what you do. But I want to ask you the question another way. How do you communicate with social groups groups? How do you make some social influence and meeting with society? Because it's a very acute topic for us. Then we don't know, because society is very scared about the addictions, about especially work in such methodics with children and so on, how you overcome these fears. And this is very interesting how you deal it.
Mm-hmm. So, you know, I came to Israel, I studied in the States, and I came back to Israel 14 years ago. And it's been 14 years ago for our group doing conferences, scientific conferences, and showing the studies, the results. We work with the government, the Ministry of Health and the Ministry of Security, and we do a lot of education about the possibility, the potential. A lot of things are coming from the state now, and we're using it. There are TED Talks, there are even things in Netflix or books. And so we create access to knowledge that is based on either clinical data, but also other kinds of knowledge that are coming from the field that I think is valuable very much too. So we just created access to knowledge to different stakeholders in Israel, the government, the army, media. We work with universities in Israel. So in different universities, we created research groups, and each research group is working on studies. So we really worked hard and slowly and based as much as we can at clinical data. And there was much before we started too. You know, it's a second wave of studies. We had lots of data from the 50s. We're doing we are all invited. We're doing a very big international conference next December 23 in Tel Aviv. And we're presenting a lot of international data in different multidisciplinary fields. So we do a lot of that in order to create access to this knowledge that was lost because of lots of political and cultural stuff of the past. So we're bringing this knowledge back in any way we can, as long as it's grounded in data.
Thank you so much. You think someday it will be possible to work with children or with young people?
You know, I don't know. The FDA is asking us eventually to do, as far as I know, phase 4 on kids, 12 to 16. I have no experience with that. I'm a bit cautious. But I also hear about or meet kids that are in awful situations. So it's also a question of who are you working with? And if the situation of their life is so awful they cannot function and they are in a very deep suffering, and there is an option with a risk, I think it's worth trying at least at this severe wounded population. And also remember that the safety data is pretty strong. So at the beginning I had a resistance maybe 5 years ago, and now I'm more open to this possibility, and especially with the population of kids that are, it's hard to help them. We don't have any other way to help them right now. It may or may not be the right way.
Дякуємо дуже. Пане, і вас звати? Сергій, все, щоб ми просто розуміли. Да, друзі, будь ласка, представляйтеся, щоб ми знали, як потім до вас звертатися під час нетворкінгу.
Да, Сергій, лікар, психотерапевт, голова психологічної служби Медичних сил Збройних сил України, Центральний регіон.
Дякуємо вам дуже. Супер. Keren, thank you very much for your invaluable time. May I ask you to say a couple of last encouraging words for us before we move on with our conference?
I'm just, kind of feeling what's happening with you. And I know those places from Israel and the Middle East. We've been there many times in different ways. And I want you to remember that there is an end to that. And there is lots of ways to walk with the wounds that are going to be available for you. So I just want to remind you there is an end to the war eventually. And then there is lots of healing potential in so many ways, not only with psychedelics, but also. And definitely me and my team and other people all around the world with psychedelic are thinking of you and would like to help. Yeah, so we are here.
Dr. Keren Tsarfati, thank you very much. Що ж, друзі, ми будемо з вами продовжувати. Дозвольте з вами поділитися деякими змінами в нашій програмі. Найбільш навіть аджендою, розуміють, що зараз, по ідеї, мають виступати Маркус та Ембер Капоне. Вони вибачаються перед нами, вони не змогли, не встигли у зв'язку з сімейними обставинами до нас звернутися і вийти на прямий зв'язок, тому замість них буде наш великий друг України Джон Лубецькі, який сьогодні присутній безпосередньо в цій залі, але ми його також попросили виступити останнім в цій сесії вже перед обідом. Ось, саме тому у нас зараз будуть ще два виступи. Люди, які їх будуть надавати, вони також не присутні з нами онлайн у зв'язку з часовими поясами, перельотами і так далі, але тим не менше ми попросили їх записати для нас відео, власне кажучи, в яких вони також будуть розкривати міжнародний досвід. І спершу ми познайомимося з досвідом Канади. Зараз з нами буде на зв'язку нейропсихолог.
Dr. Chernoloz is a specialist in neuropsychopharmacology with a PhD in neuroscience from the University of Ottawa. Will perform her speech now. Good afternoon. I'm glad to greet everyone who will join us today and would like to thank the organizers for the opportunity to join the discussion of such an important subject. Usually, during my speeches, I talk about how drugs work in our brain. But today, my speech will be about the ways we measure different things, such as treatment costs, lost hands, and so on. Medicine and economics are supposed to have different ways to measure different things. But how to measure pain? By tanks of mothers' tears who bury their children, or by years of cold wisdom and patience added to the age of our children, or by separated families, or maybe by phone numbers that will never answer. In medicine, the daily indicator is often used. It means disability-adjusted life years. It measures the total burden of disease expressed in the number of years lost due to poor health conditions, disability, or premature death. Unfortunately, when we talk about post-traumatic stress disorder, premature death often means suicide. One daily is equal to 1 year of lost healthy life. According to the studies conducted in University of Münster in Germany, the first wave of war in Ukraine, only for years 2014-2015, caused the loss of 30,000 dailies, healthy years of life, because such mental disorders like PTSD and depression. Taking into account today's scale of war in Ukraine, I'm even afraid to suppose how many healthy years will be lost by Ukrainian people. The years which could be spent by building their future, watching their children growing up, working on significant projects. Russia's military aggression against Ukraine has serious consequences for the mental health of Ukrainians. PTSD, depression and anxiety disorder are the most widespread of them. It will be possible to estimate these consequences exactly only after the years, but we can obtain certain information about the extent of the problem from scientific studies about the effect of wars on mental health. According to WHO, about 10% of people who experienced psychotraumatic events will have PTSD. Also 10% will possibly have behavioral disorders. Servicemen suffer from PTSD 2-3 times more often. In case they also have traumatic brain injuries, the percentage becomes even higher. In addition to thousands and thousands of military servicemen who directly experienced the horrors of war, we have the largest human displacement crisis. The latest data reveals that around 7 million of Ukrainians had to leave the country, and other 7 million of people are internally displaced people. Almost 14 million people didn't sleep in their beds today, as well as many months before. escaping from horrors of war. It is known that the largest burden of mental problems is observed in population who suffered from the war conflict. International study conducted with participation of Kyiv International Institute of Sociology in 2016 estimated mental health of war refugees from the east of Ukraine. This study showed that the spread of mental disorders among internally displaced people can reach 32% for PTSD, 22% for depression, and 18% for anxiety disorders. These data correspond with large population studies that demonstrate that the number of people who have PTSD, clinical depression, or anxiety disorder affected by war reaches 30–40%. A much larger number of people can have separate symptoms of depression, up to 88%. Certainly, it doesn't mean that each Ukrainian will have any kind of disorder, or that 20% of servicemen will definitely have PTSD. Ukrainian reality is a little bit more complicated than statistics. But taking into account the number of people affected by war, such statistics can provide at least approximate estimation. So the forecast of Ministry of Health states that the number of people who will need mental support is around 15 million of Ukrainians, and from 3 to 4 million Ukrainians will need drug treatment. Let's stop for a moment and come back to the clinical position. PTSD is mental illness which can progress after experiencing or observing of some traumatic event. It can cause intense stress and disimprove a person's ability to function. What do you imagine when you think about a person who suffers from PTSD? A person who wakes up from nightmares, tensed as a string or as a bare high-voltage wire? A person who seems to be with you physically, but is actually somewhere far away mentally? People who suffer from PTSD state that their condition negatively affects almost every aspect of their life: social, family life, ability to create close relationships, do their house duties, work or study. They are yesterday heroes who today cannot go shopping by themselves, cannot contribute to their society, and the worst is they can feel themselves as a burden for society, family, colleagues and community. Let's be honest. The issue of mental health in Ukraine still remains as a stigmatized problem. At least it was before the beginning of war, and I hope we all will change such attitude to this problem. People are afraid to seem weak and disabled, and that is why they try to overcome their pain on their own. Such self-help is often even more harmful for the person and surrounded people. They are too strong to ask for help, and they use destructive defense mechanisms, avoiding other people, staying aside from others, avoiding any reminders of their trauma, demonstrating anger and violence, overusing alcohol, endangering themselves and others. We should get rid of this shame of asking help, to struggle the stigma with the firmness as well as we struggle against the enemy, to make it normal that pain can and must be admitted, and it's normal to seek help, and help will be always provided. We must do the best for their recovery, like today they do their best to survive Ukraine. We should hope for peace not only in our cities and villages, but also in hearts and minds of our people. We realize that PTSD means impatience, anger, problems with concentration, memory, hopelessness, loss of interest for activities which were favorite before, insomnia, and relationship issues. Besides the symptoms of the illness, PTSD is often connected with concomitant mental disorders, such as depression and anxiety. In fact, 80% people with PTSD have at least one concomitant mental disorder, and 44% of them have two or more disorders. But except for direct symptoms, there are some related physical diseases, like metabolic, cardiovascular diseases, autoimmune diseases, chronic pain, and sleep disorder. These diseases can additionally complicate the life of person with PTSD and can complicate a treatment and increase its cost. From an economic point of view, the approach to estimation of treatment costs involves both direct and indirect expenses. Direct expenses are the ones for treatment, staying at hospital, specialist time, laboratory tests, prescribed medicines, and also disability payments. There are also some indirect expenses. It is lost productivity because of illness. It is the daily we talked about at the beginning. So PTSD is connected with decrease of employment for 19% and decrease of family income for 26%. Cost for PTSD treatment also involves expenses for support and additional treatment from improper ways of adaptation, such as alcohol and other addictions. It should be also pointed out that 30–60% of these adaptations, such as have alcohol abuse. So again, we talk not about only medical component of the illness, but about loss of productivity, decreasing of quality of life, tense in family relationships, and even possibly about workload to the criminal justice system. In absolute numbers, in the USA, the cost of PTSD treatment is almost $3 billion annually. Moreover, over the half of these expenses is caused by loss of productivity of these people, and the smaller part of the sum is used to the treatment. If we talk about mental health in general, in Europe, economic losses caused by mental illnesses reach more than €600 billion in 27 countries of European Union. That is almost 4% of their gross domestic product. And European people have ordinary mental health problems without war. So when we don't provide proper help for our people who suffer from pain, it means not only these people suffer, but the economy of the country in general. We need to rebuild the country. And we need each Ukrainian will be capable to join. Some of the patients who suffer from PTSD can recover during several months, while others can suffer for years and even decades. The study conducted by University of Paris in 2015 determined that average duration of PTSD is 5 and 3 years. Today, the first choice treatment for PTSD is psychotherapy. Drug treatment is also using like antidepressants. Clinical researchers demonstrate that using of all these methods can guarantee some improvement for many patients, but only 40% of patients completely recover. As I mentioned before, PTSD is often connected with other related diseases. According to the statistics, such a combination is usual for half of all cases of PTSD. Unfortunately, such cases of concomitant diseases are the most difficult to treat, while the risk of combination of such concomitant diseases among military servicemen is higher than among patients from other categories. What is really terrible is the understanding of how low is the bar of our treatment successes now. Even in less complicated cases, current methods, including psychotherapy and pharmacotherapy, remain around 30% of patients without any relief. Do you realize? Each third person who asked us for help, we just said, sorry, we tried everything we can, and we cannot do anything more. Go home, help yourself. Can you imagine? We give up on each third person. We defeated this person to illness. Each third today's hero are decommissioned. If each third soldier gave up now, would we still have our country? What moral right we have to give up, especially when there are evidence-based methods that can help, and in addition, they are economically profitable. In treatment-resistant cases, the psychedelic-assisted therapy could help, but internationally recognized and breakthrough method, which is poorly known in Ukraine. Psychedelic-assisted therapy involves the use of artificially induced short-term changes in the work of various neural networks of the brain to facilitate the psychotherapeutic effect. Particular psychotropic drugs are used for this. MDMA and psilocybin-assisted PAT is already used in expanded access programs in Israel, the USA, Canada, and Australia. American FDA in 2017 officially recognized MDMA-assisted therapy as a breakthrough method of treatment from PTSD. And in 2018, it was recognized as a breakthrough method of treatment depression. 107 clinical trials of PAT for treatment of different mental disorders have been registered since 2020. In summer 2022, the second clinical trial, phase 3, of studying of MDMA for TSD treatment was finished. It was conducted in 13 clinics in the USA and Israel. The results of these trials were such incredible that in the same year, the USA President administration officially announced the preparation for their wide implementation. It is expected that MDMA-assisted therapy will become a legal form of therapy in the USA the next year. 50 years ago, the USA promoted the world community to prohibit psychedelic substances. Today, they have enough wisdom to consider the science and change their mind and policy, recognizing the importance of clinical data created with help of 100 clinical trials. By the way, in Europe, the President of the European Commission, recognizing the crisis of mental health, started her speech to European Parliament from this subject at the opening of the session last year. It is expected that the memorandum on a comprehensive approach to mental health in European Union will be announced in a month, and the new methods of treatment, including the ones we talk about today, are mentioned in a pre-form of this document as innovative ways of treatment. Today, the level of cooperation between Ukraine and our Western partners is the strongest we ever had. We can settle working dialogue between Ministry of Health of Ukraine and jurisdictions which follow compassionate and pragmatic policy to allow this method of therapy as a choice for treatment of our people. So how effective PAT is? The effectiveness of PAT is higher than accepted methods of first choice, at least in PTSD, depression, and some anxiety disorder therapy. The meta-analysis of clinical trials confirms it. For example, after 3 sessions of MDMA-assisted therapy for treatment-resistant PTSD, 88% of patients from experimental group felt essential relief of their symptoms. Herewith, 67% of them fully recovered from PTSD. In the control group treated only by psychotherapy, standard therapy used now, only 32% of patients recovered. Positive effect of MDMA-assisted therapy is kept during re-examination after 2, 6, and up to 24 months after finishing of studies. When new medicines are launched on the market, the cost of treatment isn't taken into account while making decision. If the drugs are safe, effective, and somehow better than current treatment methods, they are approved. The cost of a therapy is a secondary aspect. But this issue has great influence on healthcare system in general. Economically, PAT is also more effective. Even expensive protocol of MDMA-assisted therapy used in clinical trials in the USA in long-term prospect has 36% lower cost than first-choice methods. Do you remember I started from telling you that after the first wave of war, Only for 2014-2015, we lost around 30,000 healthy years of people's life. And Europe, because of mental health issues, loses up to 4% of GDP. Are we ready to give 100,000 of years of Ukrainian lives or billions from budget? That's what happens when we cannot treat people effectively. To help our people who nowadays struggle for our freedom by their blood, sweat and tears is our duty. My grandfather, Ivan Chernyaevsky, experienced 2 long years in occupation during World War II. He lived in digging hole with his mother and paralyzed father. When my Kramatorsk was deoccupied, he was 17, and he was adult enough to join the army. He went through the whole war, being contused in Austria just several weeks before the victory. His contusion was so severe that he spent 2 years of treatment in a hospital to come back to his normal life. This contusion, together with all horrors experienced during the war, changed him forever. I never knew him, unfortunately. My mother and he were the best friends, but it didn't stop him from sold her belongings to drown his pain in alcohol. Such a method of therapy was pretty acceptable in Soviet Union. This is heritage which we want to get rid of as soon as possible. My mother was 16 when my grandfather passed away. Of course, we need to recognize our heroes, name the streets after dead heroes, and to reward the bravery of live ones by medals. But combat awards couldn't cover the hole in my grandfather's soul, the hole created by war, which is spilling out from these holes, and their life as well. There are people around us who fortunately have pulse and all body parts, but they don't have their lives. Today, we can choose to stay in this delusion with common known image of drugs inflicted by the enemy. Or maybe our heroes didn't suffer enough. Will they have to suffer when the peace comes? Probably for years, because the country blocks really effective methods of treatment for them. Or we can choose to get rid of the Soviet heritage and just call the substances differently, as medicines, and treat them accordingly. Certainly, these substances can have some side effects as every other drug. But let's be honest, morphine or chemotherapy drugs have a much higher side effect profile, but we still use them. And it's completely legal because they save lives, as well as psychedelics. Even non-medicinal substances which we openly use can be dangerous. A bottle of beer drunk with friends will not harm you, but 10 of them every day will. Or if I'll drink 10 liters of water for 1 hour or will eat half a kilo of salt, I will die. In most cases, the difference is between how we use something, not what we use. Let's be honest. Nowadays, our people suffer, and they will use all ways to improve their situation. If the country cannot support it, they will go by non-traditional ways. They will go to magicians, will stand on nails, will look for the ability to use these psychoactive substances, doing it in non-regulated environment. Our people are smart. They have access to all this data about therapeutic potential of these substances. They will go to friends of friends where nobody knows which substance they will receive, how it was produced, and does the person have any understanding of how to deal with this state? We want to help our heroes, or to hurt them, or even criminalize them. Nowadays, Ukraine is the example for the world in various aspects. By our courage, by implementation of digital technologies, psychedelic medicine can become one more thing for Ukraine to be in the vanguard and to lead the world in implementing of this form of therapy for real care for its heroes. Ukrainians know that revolutions can be a necessary step to avoid the spread of evil and injustice. Crisis of mental health destroyed by this war, as well as our cities, will need therapeutic revolution to save our people from life with a shadow of disappointment and pain. I never knew my grandfather, unfortunately. I would like our children to have their parents and grandparents, not only their bodies, but their souls. The souls which outstood in human pain, but were able not to stuck in it, but to come over all of it, leave it in past, and rebuild a new life. I want you to measure not years of disability and cost of psychotrauma for the economy, but happiness, happiness of victory, happiness of unity, happiness because heroes and refugees come back home and rebuild their life. Happiness because we will bring life to children who will never hear air raid alert and explosion sounds. Happiness because we could fix lives broken by the war. Thank you.
Thank you very much. We hope that during the second conference, which I hope will take place and not long from now, we hope to see Mrs. Olga in person, and we're going to move to the next stage and our next speaker, Eric Vermetten, who wanted to be with us, but because his plane is just landing in the Netherlands right now as we speak, he could not be with us, but he recorded a video with us and he decided to share the most key adequate information. And I would like to demonstrate those words of encouragement which sound from everywhere in the world, from all the professional communities and leading specialists in the field of implementing psychedelics for psychic health.
My name is Amanda Feilding, and I founded and run the Beckley Foundation, which I started in 1998, in order to research psychedelic compounds and their potential for healing sickness in us humans, and also inspiring us and making us able to change our behavior and adapt more readily. So over the last 50 years, I've done much research, and I'm very convinced of the potential of these compounds to help us heal our many sufferings. And we have enormous admiration for you in Ukraine, who have fought so nobly the invasion of your country and have suffered such enormous trauma and damage from being attacked in the way you have been. And our hearts go out to you. And when I met Kate Kaif at a conference in Amsterdam, I said to her how wonderful it would be to set up a trauma center in Ukraine to help treat the traumas of both soldiers and civilians. And I was suggesting that your wonderful president and his wife should head this campaign and make it happen, because it's a difficult thing to make happen, and it needs someone with their resilience and intelligence to make these things happen quickly and cleverly to aid the suffering which has happened. And so, why does it work, psychedelics? Because they heal from the bottom. What they're doing is increasing the energy in the brain. It increases the blood supply to the brain and thereby gives extra energy for all of the brain to be working together. And by that means, there's much more neuroplasticity, which means that the state of the brain can be altered. So when a trauma has happened, one can overcome it from the bottom up. And that is the most wonderful thing to happen. It can give an individual, and we've all been traumatized to some extent, but obviously you who have suffered war, it's much, much worse. One can then get rid of it. One can clean it out of one's body and start a new pattern of behavior, which is much more positive and will help people have a happier life thereon. So I strongly, strongly advise taking that level, that line, to clear up the terrible suffering that has been endured. But all I can say is how much I, and the rest of people in the world admire your fortitude, strength, nobility in fighting for what is right for you. And I do think that psychedelic-assisted therapy could be a great help in overcoming the horrors that have happened and returning you to your happy ruling of your own country yourself. My very best luck and love to all of you. Goodbye.
Amanda Feilding, це її підтримка.
Amanda Feilding, that is her support. Thank you so much. So, dear friends, we're moving on, and as of now, we'll have the video from the psychiatrist who is working with the ex-combatants as a strategic advisor of the research in the mental health of the Ministry of Defense of Netherlands at the National Center of Psychotrauma and IQ, Dr. Eric Vermetten. But before we are able to move on and to listen to Dr. Eric, who wanted to be with us personally, I'd like to mention one more important point. We are now working together and to hear the interpretation. We are having the simultaneous interpretation here, and I would like to express my gratitude for that, because I used to be a simultaneous interpreter myself, and I definitely know how complicated this work is and how it really impacts the brain. So I think in the same way as psychedelics, different parts of the brain begin to conjoin and they begin to work together. That is why if somewhere something is omissed or also not mentioned, please pay attention that the people are working live and are hearing what the international experts are speaking through Zoom with some of the issues in the sound. After that, we'll make everything in order, we'll make the proper voiceover, and you will see the high quality. So thank you for your patience, thank you to our interpreters, and we're moving on directly to Dr. Eric Vermetten.
Okay, so I am recording and I will start my presentation by sharing the screen. Just give me a minute to start sharing my screen. Okay, here we go. Here we go. Here we go. All right. So, welcome, and thank you for inviting me for your important conference. Welcome to all the attendees in Kiev for this wonderful conference. Timely, and I hope that you'll all be able to tune in to this topic. And I will be presenting virtual to you this evening or this morning or wherever you're calling in from or being live in Kiev. My name is Eric Vermetten. I'm a retired colonel in the Dutch Armed Forces, and I'm a professor of psychiatry in Leiden University Medical Center. And I will be talking briefly in the next 20 minutes about a critical appraisal of the use of psychedelics for PTSD. I'm sorry that I cannot be there, I wouldn't say live, but at least live on Zoom with you. I'm currently in New York, and maybe at the background you see New York Times Square. And just a backup in case I will not be able to be there because I might be in the plane to deliver this presentation to you while you're having your conference. So without further ado, I will be walking you through a couple of slides that will help you familiarize with themes that have passionated me over my professional career. But I'll start with a reflection. On 5 years ago, I was in Odessa, 2018, in Odessa with a group of experts, and we're talking about risk management for terrorism-induced stress. And you see here in a picture a range of my colleagues, friends who were there with me, and who could tell, who could know that now 5 years ago you are involved in a war, in a huge conflict that reaches not only Ukraine but far beyond that. And the topic that we were addressing, risk management of terrorism-induced stress, has brought us together in a way, because what we're trying to do is mitigate the impact of trauma. And some parts have been behind us, but we don't know what's facing us and what's ahead of us. And maybe we have the expertise and some tools and tips and techniques that we may be able to apply to situations where we're currently at and that you're currently at in these difficult circumstances. So I've been working as a psychiatrist dealing with active duty military service members and veterans in conflicts. And on this slide, you'll see the conflicts represented by a couple of pictures in Afghanistan, former Yugoslavia. And you see on the top right, the conflict that you're in with the Ukrainian flag, but also in the bottom corner, you see the impact, the physical impact, where you see this young boy who's missing both of his lower limbs. And we need to be prepared for these aftermaths of the missions. The missions are complex, they're ambiguous, and they're violent. Killed in war, wounded in war, and the recent conflicts that we've been in, and I've been dealing with service members that are returning from war, are impacting us with a lot of questions and a lot of challenges at the same time. In this slide, you see a range of names that we gave to psychotrauma impacts. Now, I will be talking to you briefly about PTSD, but PTSD has not been with us longer than the last 40 years. You see in red here, it starts with soldier's heart that comes from the First World War, and shell shock, citroneurosis, or le froid de la mort. I won't go over all the details of what you see on this slide, but it confronts us with names that have been given to disorders that were related to the impact of war, of combat. And what you see now in the east of Ukraine is that soldiers are returning from the trench war that's currently being fought there. And you know even better than I do that that look like people that we have seen 100 years ago that we would diagnose with shell shock. And maybe if you can see that on this slide here, this is what shell shock looked like 100 years ago. Shell shock was a nonverbal disorder, and it was appearing as a motor restlessness where it wasn't a verbal disorder, but it was a disorder that you could see because of the verbal, the nonverbal motor manifestations that people had. And only since 1980, we've been calling this disorder PTSD, and we could wonder, and sometimes I challenge students, like, what's the half-life of PTSD? How long is PTSD going to stay with us? Is it going to be replaced with another name? Is it mild traumatic brain injury? Or is it moral injury? A novel name that comes up, and you see it a lot of media reports and scientific reports. Maybe it replaces PTSD or not. And what I can share with you briefly at this moment in time is that maybe moral injury challenges us with two concepts that are critical in PTSD, which is guilt and shame. And they're not only in combat trauma, but in civilian trauma as well, that we see these reports of shame and guilt that are very difficult to tackle in our psychological approaches to PTSD. Now, PTSD in a nutshell. When I was a resident, one of the books that I was confronted with was a book by James Douglas Bremner, is Does Stress Damage the Brain? That was a concept that was very prevalent when I was a resident. A few years later, or a decade later, actually, it was a book by Joseph Ledoux, who wrote about the emotional brain. And it wasn't so much the hippocampus, but it was the amygdala that came to the forefront of an etiological contributor to the pathophysiology of PTSD. And maybe you've read the book and I hope it'll be translated in Ukrainian as well soon. It is a book by Bessel van der Kolk, a Dutchman. The Body Keeps the Score, and it's a very appealing book, an approachable book. It's a book that's very well written, and it's on the New York Times bestseller, nonfiction bestseller list for the last, I think, 3 years in a row. So in a nutshell, I said we look, if we look at PTSD, we come from a time where we look at PTSD from a perspective that it was a disorder of hippocampal malfunction. Later, it was attributable to the amygdala that had to do with the emotional dysregulation that was very prevalent in PTSD. There's been a lot of prevalence battles. What's the prevalence of PTSD after combat? Is it 2%? Is it 20%? Is it 50%? And I've been involved in a couple of papers also where the UK and the US service members were kind of fighting about who has the highest or the lowest prevalence after combat. Now, when we look at treatment effects in the treatment of PTSD, we see small effect sizes in the evidence-based interventions that we currently have at hand. And there's a flurry of studies that look at the impact of our evidence-based interventions, and we need to do better. We need to sort of invent or create or approach opportunities that would allow us to do better and have higher effect sizes. That's a challenge I think we have. A thing that puzzles me still is what we now call delayed PTSD. What is delayed PTSD is what you see on the right side of the slope here is the red and the blue and the green. And particularly if you look at the blue, this is a long-term follow-up of soldiers who've been deployed to Afghanistan, a far away combat that we war or conflicts that we've been sending troops to. And what you see on the blue is that after 2 years, there's sort of a group of people, and that's a sizable group, that's just like, Doc, I'm okay. Don't worry, I'm fine. But if you keep following that group, 5 years down the line, they start reporting symptoms. I'm not doing fine. I have nightmares. I have irritability. I'm not doing really well, which is representing the delayed type of PTSD. It's something that puzzles me throughout my career. What is it? Did we know them already in advance, or could we have prevented them from happening? And interestingly enough, is the delayed type of PTSD a kind of a typical presentation of a disorder that deserves another type of treatment than the immediate presentation of PTSD? So if veterans return from the east of Ukraine with this PTSD type, do they require a different type of intervention than the ones that probably in 2026 or 2028 will report symptoms of PTSD? That's a question. That's at the same time a challenge for us therapists to anticipate to. So we've had a flurry of medications. We had Zoloft, Prozac, Paxils, and actually looking back at times where we've used these compounds, they've been shock absorbers. They never cure PTSD. They absorb the shocks. They are symptom absorbers for PTSD, which is fine. But we have to be modest about the impact that they have for the treatment of PTSD. A new lead in the orientation towards the impact of trauma is MI. What is MI? Is moral injury. Moral injury, as I said, is on the forefront now in a lot of media reports and coverages. It is this guilt and this shame component to the pathophysiology, often of chronic manifestations of PTSD. It may have to do with guilt and shame. It also may have to do with the inability to forgive and to sort of self-forgive or to forgive the other. Or maybe if you want to call it in a spiritual way, the divine or the God or the higher authority. And there's many overlapping sort of components of PTSD and moral injury. And there's a lot of research on looking into that. This is me. You see me here, my uniform. I retired in the end of 2021. You see briefly my career that I had in the armed forces. I was the head of department, the head of military research, military mental health research at the Central Military Hospital, and I'm now a professor of psychiatry at the Leiden University Medical Center, and I'm also working as a consultant to the United Nations. Now, the question that is very prevalent probably here in the audience and for you and for me as well, do we need new treatments for military PTSD? This is a review by Neil Kitchener from John Bisson's group in Wales. And he said, we see lower effect sizes than for other populations of PTSD, civilian PTSD. And we need more effective treatments for military PTSD particularly. So that is at stake. New emerging therapies that are out there are using technology, leveraging technology, like virtual reality therapies. You see here HoloLens. You see here an instrumentation using a treadmill. That's what I've also been involved with heavily, is what we call 3MDR, where veterans walk into pictures that they have taken into the therapy themselves of representatives representing experiences and memories of the time that they were deployed. That we use music and we use computers and instrumentation to deliver therapy in a kind of a novel way. Won't talk about that much, but also something like use of animal-assisted psychotherapies, the use of cannabis, ganglion stellate ganglion block, are new emerging therapies, ketamine, or narrative exposure therapies, and other forms of therapies that are emerging, that are not yet maybe all evidence-based, that are driving a new lead towards therapy that may help with symptom modification and relief. Here is a list of all the therapies. I just was involved as a co-author on a paper by Lisa Burback that will be out shortly, where we have listed all the emerging therapies for PTSD, and there are 4 columns. And there's the cannabis, and there's the oxytocin, there's the propranolol on the 1 column. There's all these animal-assisted psychotherapies and psychedelics, and I'll talk about that in a minute. In yellow here, that is driving also a new lead, a very high-profile new lead. There's neuromodulation, there's neurofeedback, and on the far end, there's spiritual focused therapies that are also a driver for research. Just to go back 50 years ago, and maybe you do not know this guy, this is Jan Bastians. And Jan Bastians was a psychiatrist, and he was the head of research, head of the Department of Psychiatry at Leiden University Medical Center, where I'm currently employed as a psychiatrist. And he was using LSD in the treatment of Holocaust survivors, people who survived Auschwitz or other concentration camps. And they were not liberated, they were still captive in their brains, in their minds, years after the war. And with psychoanalysis or other forms of psychotherapy, he couldn't liberate them. He could liberate them with a psychoactive component of LSD. And there's not that much research on Jan Bastians. There's just recently a book, it's called Liberated, it's translated in English, on the treatment of concentration camp survivors with LSD. Now, a study that blew my mind is this study, and you have Rick Doblin as one of the presenters, and actually, I think he opened this conference. That blew my mind. And very briefly, therefore, this was the placebo response of people who participated in a double-blind crossover study with MDMA-assisted psychotherapy, and it's a beautiful effect size. But when I saw that the effects of being treated with 1, 2, 3 sessions of MDMA was that profound, I felt we had a moral imperative, a moral obligation to explore this in the service members, in the veterans, if on my case, that we weren't able to treat with our evidence-based interventions such as psychotherapy. So what would the added benefit of MDMA be? And now a flurry of research has led to the exploration of MDMA-assisted psychotherapy, and we'll see how that will also have an impact in Ukraine and an opportunity for you to benefit from. Now, the design of the studies have been outlined by Rick Doblin and probably by others. It's not just you have to do MDMA every day as a sort of a symptom relief. No, discrete moments in time where you have to use MDMA for an 8-hour session, and there's integrated sessions in between. The beauty of that actually is what you create with MDMA is a social reward learning critical period that's driven by oxytocin, that because of the pro-social impact of oxytocin, there's an opportunity to relearn, to have a sort of a corrective experience to the things that you have been hardwired with in your brain. And it's one of the theories, one of the approaches to explain why MDMA may be so effective. And what you see here on the lower bottom is 2 hours into MDMA, you see a big boost of oxytocin that may explain why the pro-social effect of MDMA is so important. And this is a beautiful paper, by the way, from Romain Nardou by Gould Dolan's group from Johns Hopkins, came out in, I think it was 2019. That's really a worthy read. Now, won't show you this, but this is a snippet from a video that I've seen a lot of times where a Marine veteran was on a tour in I think, yeah, here it is, in Iraq, and he saw his buddy being blown up. And by the MDMA experience, he was able to revisit the experience that otherwise would have been associated with a lot of panic and avoidant behavior. And by the MDMA, he was able to tolerate the affect and be able to revisit the experience where his buddy was being blown up in a Humvee while he was under enemy fire. And he was able to work through a series of experiences that would sort of as if it was an onion, and you could unpeel the layers of the onion and come to the sort of the, call it self-forgiveness or forgiveness of the other, or actually an acceptance of the situation that then he could tolerate the affect of that. Before that, he was only able to react to and be aggressive to his wife and to his kids and to other people. And he kind of felt that reconciliation in a way that was helpful for him. And I hope that at this conference you have an opportunity to show or familiarize yourself with this video and appreciate it.
Think about it now.
So, okay. So what are the key change phenomena of MDMA-assisted psychotherapy for the treatment of PTSD? We've done an analysis of some of the videos that were given to us from MAPS a couple of years ago when we looked specifically at the integrative sessions. And we had 2,240 minutes of video recorded material. And we analyzed with an interpretative phenomenological analysis what the key phenomena were of change. And here they are identified as the tolerance of conflict, the staying with what is, the processing of trauma, positive emotions of self-acceptance, joy, happiness, gratitude, interpersonal gratitude, compassion, empathy, and connection. The wider perspective, what Rick Doblin and others, Michael Miethofer and MAPS would say, the inner healer intelligence, the accessibility to emotions, and the mind-body connections. Now, of course, if we zoom out, then we could just say that psychedelics are not new. I'm focusing now briefly on MDMA, but we know that there's psilocybin, LSD, ketamine, ayahuasca. There's many compounds. There are compounds that have been with us for a long time, 1912, 1938, 1962, and we familiarize ourselves now with the impact that they have on altered state of consciousness and how we can use these compounds as a catalyst for a psychotherapeutic process that can help us to make the change that otherwise is quite difficult to achieve. Now, what is a psychedelic drug? Of course, you've heard much about that. Of course, there's no real consensus about what's a psychedelic drug, but it promotes a change of consciousness, perception, acuity of senses. It has a noetic sense of revelation or a transpersonal quality. It's mind manifesting. And it challenges conventional definitions of hallucinations, perceptual distortions, psychomimetic states. There is an awareness of being in a drug-induced state. When you have a psychedelic on board, you realize that you're in the state, but there's a kind of an approach to be able to surrender, to let go, because there's no ability to be able to fight it. One can make sense of being in it and reflect on the experience while it's happening and later as well. And there's a beautiful an array of art in psychedelic artists and music and romance literature, I should say, on authors who've comforted us with their experiences. So when we look at the number of psychedelic trials over the last decade or so, we see that there's a flurry of trials that are out there in using MDMA, LSD, psilocybin, and an array of where these drugs are now provided to us as medicines and not as recreational drugs. And you didn't hear me say anything about recreational drugs. I call these compounds medicines, and I hope that they can be used for their medicinal quality, and that they can be perceived and appreciated as such. Oh, and just briefly at the bottom here, you see, and I just updated this, there are now 45 studies. If you go to clinicalgov.com, 45 studies on psychedelics and PTSD, 31 specifically on MDMA, of which 19 are completed, and there are 6 studies with psilocybin, of which none has yet completed. Now, David Nutt, I think he was also a presenter at this conference, where he talked about the brave new world of psychedelics, and this is just a snapshot of 2 papers that confront us with the impact that these psychedelic drugs have in our literature and our scientific contributions. Robin Carhart-Harris, who's now at San Francisco, opened the world's first center for psychedelic research and has contributed with a lot of theories and novel approaches that we are learning from a lot. And is Mary Cosimato, who's with you as well at this conference. She's here at Johns Hopkins, where there's a patient with probably fear, end-of-life anxiety, or other rationale why they're using psilocybin. Beautiful center. And Rachel Yehuda, who has launched the first psychedelic research center in Mount Sinai in New York. Now, so there's multiple universities that are now using a psychedelic approach. In the Netherlands, we have Leiden University Medical Center, we have UMC Utrecht, UMC Groningen, and Maastricht University, 4 major universities that are looking into the opportunities that we have with psychedelics. So is there a psychedelic revolution? You may wonder, as you're here in the audience and hear me talk about, like, okay, is there a psychedelic revolution? That's why you have that conference, probably. Is psychiatry never going to be the same? Is it going to be helpful, and it's going to help us with this conflict with other enemies and with humiliation of the suffering of so many veterans and also civilians inside and outside of Ukraine? Is psychiatry ever going to be the same? I don't know. And there's a beautiful paper that I wanted to draw your attention to by Dan Stein in World Psychiatry last year. This is like, no, psychiatry is not going to move out of its comfort zone, and there's a big revolution. It's never going to be the same. Psychiatry is going to move with incremental steps. We have to maybe familiarize ourselves incrementally with opportunities that are at hand, and there's so much at stake: industry and safety and legality that we have to face and address very carefully. Now, I addressed PTSD to you, and PTSD has been on my radar for a long time. Here's with Erin Kredit, who has reviewing the potential of psychedelics in the treatment of PTSD. And when you review the literature and the treatment of PTSD, it's not only MDMA, but there is also a literature on the use of ketamine, classical psychedelics like psilocybin, and cannabinoids. Even though you may wonder, like, is now cannabinoids a psychedelic or not a psychedelic? There's a literature, and you can see that there's an approach to view cannabis, medical cannabis, as an opportunity to incorporate in this domain as well. So the critical questions are: how do these compounds work? Are there any adverse effects? Are they a combination therapy? And you may hear me say that they can only be useful in the combination with psychotherapy as a catalyst for the psychotherapeutic process. What is a theory or a therapeutic approach? Is it placebo, or is it, how do these compounds work? And what training do you need to give to therapists to be able to work with these compounds? What training needs to be followed to be educated in working with these compounds? Do you need to have had a self-experience to work with these compounds? Is that necessary? Would it be helpful? So I'm going like a whirlwind. I understand that, and here you see another slide where I'm briefly showing you the optimal arousal zone that we try to work with in dealing with psychedelics. We don't over medicate somebody or under medicate somebody, but find a comfort zone where we can work with the affect and where we can work with distress management, cognitive restructuring, and emotional regulation, which is really important for a psychotherapeutic process. And here you see three colleagues of mine that is portraying how a setting of psychedelics at Center 45, close to Leiden, where we're doing our work at this moment in MDMA-assisted psychotherapy. So psychological mechanism, there are general factors in therapy and psychotherapy, and there's psychedelic-specific factors when you're working with MDMA or psilocybin or others. And here you see a range of specific factors like embodiment, a revisiting of life priorities, ineffability that may drive the psychotherapeutic effect, specifically of the psychedelics. But we need to also be aware of bad trip experiences of transient psychological distress. There are therapeutic orientations to MDMA-assisted psychotherapy specifically, and here you see a range of opportunities or approaches like P and EMDR. Can you combine EMDR with psychedelics? Now, there's now a Barbara Rothbaum, and that's combining the approach from Edna Foa with MDMA-assisted psychotherapy. There's couples therapy and Wagner in Canada. There's family therapy. So it's in a range of, there's no one single bullet, or we have to be open to explore multiple approaches to psychotherapy in a combination with MDMA. And it's not only PTSD that can be effectively treated with MDMA. This is a slide where maybe also in neurology, we have an opportunity to explore psychedelics with cluster headache, with LSD, or neurodegenerative disorders, or pain-related indications with ketamine. So psychiatry has a new orientation to see what indications can be treated with psychedelics, and we have to sort of be open towards the disease model that we have familiarized ourselves with for such a long time, and these psychedelics have transdiagnostic capacities. I'll skip this slide. And I'll skip this slide. And I'll skip this slide. So in summary, the critical issues in psychedelics and PTSD, we do need more effective therapies. We do need specific treatment-resistant cases that can be effectively treated with PTSD. If we look at reviews and meta-analysis, there's high dropouts and there's low effect sizes that are in need of being researched. Specific indications in PTSD are the guilt and the shame that I briefly touched on, that are drivers for chronicity. Maybe we need to look at a different paradigm when we're looking at psychedelics, the critical reward learning in the use of psychedelics. And maybe there's a specific golden hour that we can, not an hour, but window of time that we can introduce when dealing with psychedelics. Now, it's been 6 years into breakthrough status after MDMA-assisted psychotherapy and same for psilocybin for treatment-resistant depression. There's phase 2 studies, and the phase 3 is out in the US, in Canada, Israel. Europe is hopefully next for a phase 3, so that there's also an appeal for registration for treatment PTSD with MDMA. Now, we have to be aware that this is a long therapy. It's 8 hours with MDMA, and people need to be comfortable with addressing therapy that long during the MDMA psychotherapy. Who can deliver this? Is it for everybody, or who needs to be trained? Are there any adverse effects, prosocial effects, boundaries, touch, training? What's the long-term follow-up? We don't know that yet. So there are studies that are out there to allow us to address that question. And what will be on the label? Is it MDMA for treatment of PTSD? Is it MDMA-assisted psychotherapy for the treatment of PTSD? And do you need to have taken MDMA or psychedelics yourself? Now you see me here on the couch with Marcela Otlahora, and I was part of a scientific experiment where either you get MDMA or you get placebo. And if you successfully work that through, then you get your certificate of completion, and then you are an MDMA-assisted psychotherapist. Now, in the USA, in the Australia, in the Netherlands, in Canada, there are special access programs, and there's committees that are reviewing now, do we need to reschedule these drugs, or do we need to give compassionate programs? And we're really at a stake as for whom? And at what moment do we give these psychedelics? Immediately after the diagnosis of PTSD, after some time of failed efforts in evidence-based interventions? So that's now at stake. Where and who and for whom we are going to deliver this therapy. So the take-home points, and I'm closing. For therapists, I think a couple of take-home points. If you're going to work with MDMA ever, or with psychedelics ever, be psychedelically informed, even if you do not plan to use these medicines in your practice. Therapists may be also in a position to do integration and harm reduction with patients who use psychedelics on their own. Be modest about the effects. Don't overstate your case. We don't know a lot of what is happening. For the scientists, again, also, there's a lot we don't know. More research is needed. You hear that every researcher say more research is needed. There needs to be, however, more recognition from professional societies. And I do see in professional societies that there is a lean forward, but also an orientation towards exploring this as a learning opportunity. Stay open-minded and avoid the hype. And for policymakers, I'd say facilitate compassionate use. From the policy perspective, it's really important that we don't let this go alone. Allow compassionate support. And for underground therapies, they should be discouraged, particularly with vulnerable patients. Provide a counterweight against underground activities. So policymakers need to be aware that they have a moral opportunity and a moral challenge and a moral imperative to regulate eligibility for specialized centers to work with psychedelic compounds. And my last bullet is don't wait to regulate until it's too late. And the last one is here, a crossword puzzle in the New York Times. If you have a psychological condition that may be treated with PTSD, I think you all know the answer. So this was a whirlwind of slides that went from PTSD history to MDMA to opportunities that we have. And I'm not here for questions at this moment in time, but I hope you have a wonderful conference and a lot of learning opportunities. And I hope that we can provide this knowledge in the interest for the patients and people who deserve it in dealing with the aftermath of trauma and PTSD. Thank you very much.
Dr. Eric
Vermetten. Dear friends, we are coming closer to the final part of the biggest and brightest part of the scientific conference, and then we will move to the zone of networking. We will communicate and have lunch. But before we do that, I would like to demonstrate one more video from the world community which will support us.
Greetings everyone, pleased to be doing this short video for Oleg and Elizabeth, and pleased to see that there's this conference happening in Kiev, focusing on psychedelic therapy. We're all so aware and concerned about what's happening in Ukraine, the impact that the war is having on so many families, whether it's people directly at the front line or their loved ones or just innocent victims. As the missiles come over, so many people are affected in so many different ways. Colleagues in my workplace, based in Ukraine, seeing how they've been impacted with loved ones who are being called up and so on, it really brings it home that this isn't so far away. And it's a reminder of the horrors and the stress of war, and that it's never as far away as perhaps we'd like to think, as we enjoy peacetime, us lucky ones in areas of the world that are free from conflict, direct conflict. It's quite a reminder. And ancestrally, personally, I wouldn't have to go back too far, a couple of generations, and my grandfather fighting in the Second World War, towards the end of the war in France, and leading a troop of men trying to free France from what was being inflicted on them at the time. So it has my deep sympathy, and the recognition over time, perhaps since the First World War with shell shock and into the Second World War, and now here we are in 2023, and thankfully there is a recognition of post-traumatic stress disorder, once upon a time called shell shock, just a thing that happens in war, but now recognized to be a disorder of the mind, an inability to, in a sense, recover from the horrors of trauma. And the good fortune that we have to have discovered how psychedelic therapy can enable people to process and digest the horrors that they've experienced. And I've seen how helpful it can be in the treatment of disorders such as depression, and now anorexia and chronic pain, and my colleagues, including colleagues at UCSF, at the front line doing work with combat veterans, working with MDMA therapy for post-traumatic stress disorder as a lead site for the MAPS phase 3 work, my colleague Jenny Mitchell in particular. It's such important work, and to see others willing to embrace the possibilities of psychedelic therapy, it's very positive. And so I'm so pleased that this is happening, and if I can contribute in any way, then I would like to. You all in Ukraine have my deepest sympathy. I hope deeply for peace and the right resolution to the conflict that's happening right now, and part of that includes a willingness to recognize and treat people who are suffering psychologically from what is happening and what's happened. So, doing the brain imaging that I do, looking in the brain, seeing how these treatments can work, adds a validity, a validation to this work, and I hope that can extend across the world and influence people and help convince those who perhaps are healthily skeptical of this intervention to look at the data and see that this certainly isn't some kind of snake oil effect. This is a deep and apparently very effective treatment with 70% response rates in depression across 3 trials now, and the MAPS MDMA therapy for PTSD work yielding incredible outcomes with, I think, close to 70% remission rates at the key endpoint. So you don't get that kind of thing with just a placebo. And looking in the brain and seeing tangible, real changes in brain function after this treatment is a further evidence for the nature of this treatment. So I wish you all the very best with the conference. I hope it goes well, and thank you for asking me to contribute, and I again just hope for a resolution to the conflict soon, and that people can work deeply on and honestly on what they're experiencing, to try to come together again and live in peace. Thank you, and take care.
Робін Carhart-Harris. Один з лідируючих
So we just heard from one of the leading experts on this topic in the world, and just as we promised, we are going to have their friend, the veteran of the army in the US, and he's an expert in this therapy and working with PTSD. John, let's welcome with applause. John.
More short introductory speech. Let's keep it without the questions. We will have the questions after the lunch because we will have more power for it. So, ladies and gentlemen, without further ado, John Lubecki.
Thanks for having me here. First, I'd like to extend my apologies for Mark
Дякую, я тільки
or participate via Zoom. However, they knew I'd be coming here to participate in the Veterans panel this afternoon, and they reached out and asked if I could speak on their behalf. Mark Snamber, in 2019, founded an organization called VETS, Veterans Exploring Treatment Solutions. And above all else, the story of VETS is a love story between these two wonderful people right here. Marcus Capone, U.S. Navy SEAL for 13 years, multiple deployments to places he can't even tell me. And when he came back, he started having problems. And one of the things that is very much forgotten is it's not just the person with PTSD. It's also their family and their loved ones that are around them and the impact that their PTSD has on them. You know, a spouse who doesn't know if the person they love most in the world is going to come home or if they're going to commit suicide. And this is a daily threat. Amber was about to leave Marcus because of his PTSD to protect herself and to protect her children, as any mother would do. And then they heard about this crazy thing called psychedelics. And Marcus was able to go down to Mexico and do Ibogaine 5-MeO treatment, which helped him to heal from his PTSD. And because of the impact that it had on their family, and it allowed them to stay together, they decided everybody deserves this, especially their fellow special operators. So what VETS does is they provide a scholarship to eligible people, which is special operations personnel, their spouses, as well as Gold Star families. Gold Star families are families that have lost somebody due to war in the United States. I don't know what that's called in Ukraine, but they have provided to date over 800 scholarships to all three of those. They've also had military sexual trauma victims go through. But people apply. If they're accepted, then they start with preparatory sessions. They have 2 preparatory sessions before they ever leave the country. They then go to a provider that has been vetted by VETS. They undergo their experience, and when they come back, they have a minimum of 3 integration sessions. And that's just a minimum because VETS stays with people the whole time. Once you receive a scholarship, VETS is going to stick with you forever. And they've come up with a lot of innovative technology to include apps and things like that to help people with integration or if things tend to come back up or they think about things in different ways and just need to discuss it. The change that this has made for the special operations community and their families cannot be understated. Or overstated, I think I messed that up. Anyway. But over the past 4 years, they have, also done something kind of hard. And Marcus and Amber both get up on stage just like I do. And we reveal our stories because that is what convinces people. And honestly, when you talk about the trauma that you've healed from day in and day out, it is emotionally draining. Something you guys will probably notice this afternoon when I'm done with the panel. I'm probably going to go outside and have a few cigarettes because it is very emotionally draining. But we stick with it because this provides hope. In the United States, none of these are FDA approved yet. Hopefully MDMA will be approved next year. And so there's a lot of people who don't have the ability to undergo this. They don't have access to it. I was very fortunate and blessed to be a participant in a clinical trial 8.5 years ago because doing psychedelics is the sole reason my son has a father instead of a folded flag. And so they go around the country, go on the news, and talk about it. But they focus on not just MDMA, like you've heard MAPS is focusing on MDMA, others are focusing on psilocybin, because they're actually providing grants for therapy. They focus on 6 different compounds. And let's see if I can get these all right. Ibogaine, which is a West African root, 5-MeO-DMT, which comes from a toad, psilocybin from mushrooms, MDMA, ketamine, and then ayahuasca. As I'm sure many people have heard, there's a lot of different places that are doing retreats and things like this. That's what they do. They provide this treatment at no charge to the veterans that go through it. They can get up here and talk for hours. But sorry. You can go to their website and look at their full program. But the biggest thing is to provide hope. I know that each and every time that I made a decision to end my life, it was because of one thing. I had lost hope of a better day. And I'm truly grateful that MAPS, who I did the clinical trial with, exists. People like Marcus and Amber exist to give hope, because we all have to wait for the FDA approval, for government approval. Everybody knows how difficult that is. But as long as there's that spark, that there's something out there, there's a light at the end of the tunnel, people will keep living. And one thing I will say to everybody with PTSD, and I say it often, but I genuinely mean it. You're far stronger and far more resilient than you will ever give yourself credit for, simply because you didn't give up and you kept fighting. And my hope is that one day here in Ukraine, not just with the bombs will stop falling and the guns will go silent, but that the people in this hospital and the people who are suffering can finally come home from war like I did 8 years ago. Thank you.
Thank you very much. John Lubecki. Wow. John, if you are telling somebody else's story that well and that deep, I can imagine only how well can you tell your story, which we will be able to listen in an hour. Thank you very much. Що ж, друзі, власне кажучи, на цьому ми завершимо.
So, dear friends, and with this, we're going to finalize our first part of the conference, and we want to thank you for your resilience, for your interaction, and for your intellectual resource. And now, what do we need to do? We need to charge up this resource and have some snack. And we have 1 hour for that. At 1400, we're going to start the next discussion. It's going to be John and a few other veterans, and they're going to present a little bit, and then we're going to open up to the opportunity to discuss. So you can think of your questions if you have any. And one more thing, in half an hour in this hall, we will be standing here with cameras, and we will be willing to talk to you about those things. And if you have snacked at that point and you want to share some thoughts with us, please come up to us so we can
will be online, and we will tell how we'll interact and what are the main rules of this interaction. Guys, could we somehow these projectors not to be that bright? Yes, it's better. So you can see we even decided to have this self-assistance and self-help. Everything is working. Okay, perfect. Dear friends, so in fact, we are ready to speak with you.
Who is listening to us right now, and especially for our friends, for 3 of our friends who are joining us up in Zoom. Jesse, Kit, David, are you with us? Can you hear us correctly?
Hi, good afternoon. Yeah, I can hear you.
Nice.
All good here.
Okay. All right. So, my name is Max. Yep, and I'm going to do my best in order to coordinate all 6 of us. And I'd like to introduce all of you, our 6 participants, and tell what are going to be the major rules of our interaction. All right. Тож, друзі, з нами сьогодні...
So, dear friends, we have here 3 of people present here. John Lubecki, who is the veteran of the US Army, the participants of clinical tests of MDMA therapy for PTSD treatment. Please, a round of applause for John. To the right from John, we have the military psychologist who got rid of PTSD with the help of PAT, Oleksiy Skirtach. And in the center, we have the Special Forces of the Armed Forces of Ukraine, who also got rid of PTSD with the help of PAT, Stanislav Gibadulin. By the way, friends, I don't know whether you saw it or not, we have the stairs which we used to get here, and Stanislav could jump that quickly and that nicely that we really witnesses about his morale.
Our guests and of our participants online, and let me introduce them. Засновник проекту Heroic Heart.
The founder of Heroic Hearts Project, the non-commercial organization which deals with the development of PAT for military veterans, Jesse Gould.
So that we know if we want to ask you some questions, so we know who we are going to be addressing it for.
And also we have the Director General of Heroic Hearts Project UK, Keith Abraham. And Executive Director of Heroic Hearts Project Canada, David Fascinato.
Thank you very much. So, guys, we'd like to have it the next and the following way. We will have 5 minutes for each of you to tell the most important things that you feel like are in need to be told. Maybe your history in the military services and the particular trauma and the conventional methods that you've undertaken, and then how did you come up to the psychedelically assisted psychotherapy. So 6 of you, 5 minutes, it's going to be 30 minutes. And then we wish to have 30-minute Q&A session with all of the participants of our conference. I don't know what are going to be the questions and who they are going to be addressed to, but hopefully we will have the question. I will repeat the question for everybody, and if you feel like you have an answer for it, please raise your hand and give us an answer. Okay, so we will start with Jesse Gould. Jesse, I've been listening to your podcast, to the podcast of one of your appearances at the podcast. There was an hour, and it still wasn't enough for you to tell everything you got to say. So please, can you just shrink it a bit and tell us what you think is necessary for us to hear?
Yeah, I'll do my best, and thanks for listening to the podcast, first of all. But absolute pleasure to be here. Absolute pleasure to discuss these important topics with whoever's watching in the Ukraine. And I do think that this discussion will be very important in terms of mental health and in terms of bringing effective modalities for a country, a population that desperately needs these options. And, we want to do everything we can to make that possible. So my name is Jesse Gould. I am currently in New York City in the US. I was a Army Ranger, a mortarman, and I was a non-commissioned officer, so in charge of many junior Rangers. I had 3 combat deployments to Afghanistan, and when I got out of the Army, I was in finance. I hit my own mental health struggles, which look like depression, anxiety, alcohol abuse. On the outside, I was successful, doing well. On the inside, just struggling with a lot of things. In the US, I went to the Department of Veteran Affairs, our mental health hospital for veterans. And unfortunately, it was just very apparent that they didn't really have good options for it. It was really a medication-focused system, which can be very helpful in some situations, but for a lot of underlying problems, it tends to mask the issue. It tends to suppress it, as opposed to actually processing and overcoming some of these mental health issues. So I found myself in a situation to where I'd either possibly be on medication for the next few decades of my life, or find another solution on my own. And so I chose the second option. Fortunately, around that same time, I heard from another podcast about these psychedelic retreats and these options, and people were having some great experiences. The problem being really wasn't available beyond clinical trials, which my colleague John Lubecki will mention in his story, I'm sure. And so the vast majority, you have to go to other countries, mostly in Latin America, Central and South America. And I had never done a psychedelic. I had the same sort of conservative idea of them as everybody else of, you do that, you're doing an illegal drug, and how's that going to help you? It's just an escape tool. But as my life was internally still kind of going downhill, I had the thought of like, what else? What else do I have to lose? So why not? Let's go for it. And so I went to these one of these retreats, these options. It was over the course of a week, a few experiences with the psychedelic, and it was very challenging because it made me confront the issues I was working with, but I just couldn't see them in a way that would allow me to overcome them. And so it gave me a new perspective on my life, on myself, on how I was dealing with trauma, and it actually allowed me to overcome a lot of them. And as well as it did seem to help me on both a physical and psychological basis. So walking away from that retreat, this was early 2017, I felt, recharged. I felt refreshed. I felt as if a lot of the burdens, a lot of the issues I was struggling with were no longer, affecting me, and no longer had the same grasp on me as they did before. Not a panacea, not a cure-all, but allowed me that little step to really change my life for the better and implement infrastructure to where that continued on. And so that's why I started Heroic Hearts Project, because at that time, I had already lost double-digit friends to suicide. I had lost more people that I knew to suicide than I did from combat, and many more were on that path. And so Heroic Hearts was one of the first of its kind organizations that was really talking to veterans about this, and then also programmatically connecting them to centers the same way that I had to kind of figure out and stumble on my own. So really to set other veterans up for success if they were in that same category, they wanted other options beside what was offered legally in the US. And so we've been running for over 6 years. We've served over 500 veterans and dozens of military spouses as well, connecting them to these retreat centers and also providing preparation for these centers, vetted spots around the world, and then aftercare, something we call integration, which the psychedelic is very important, but something that's more important is how do you use this opportunity? How do you use, when you're overcome from this trauma, to actually change your life, change your diet, change your health, your infrastructure, so that it continues on, so you don't go right back into your old patterns and go back into old trauma patterns. So that's what we've been doing. We've worked with some of the top research universities around the world, Imperial College of London, University of Texas, University of Georgia, University of Colorado to advance. And to date, all the research we've been doing has just absolutely supported the work that's showing that these substances have significant benefit to treating depression, PTSD, anxiety, addiction. And so we're super excited about this. And like I said, it's so much of an honor to be here. And, we work around the world to change these policies, change the discussion, and elevate what we can do with mental health. So, we want to be a resource for all Ukrainians, and happy to figure out and excited for this opportunity to push this discussion forward internationally. But thank you. Happy to answer any questions at the end. But like I said, absolute pleasure to be here.
Wow, man, thank you very much for your heroic heart that you're opening up for us. And I don't know whether you had a timer in front of you, but it's 5:30. That's quite an, what is it? Quite a task to pack that much information in that 5 minutes. Okay, so we are moving on. Keith, may we hear something from you?
Yeah, hi, good afternoon. I would like to echo Jesse's sentiments and say thank you very much for inviting me here and listening to what I have to say. At the risk of repeating Jesse's story, ours is, even though I'm a British veteran, it's a very similar story, and I find it's indicative of a lot of veterans, regardless of what country we're from. I served in Iraq and in Afghanistan as a British paratrooper. And while Iraq wasn't cool for me, my experiences in Afghanistan in 2008 were very difficult. And it wasn't very long after until I began to realize that this was highly likely going to have an effect on me. And then I realized that I was beginning to exhibit signs of trauma. And even though I didn't get a diagnosis at any point, I realized that I was struggling from post-traumatic stress. And I sought out help from the regular channels while I was still in the military. And I was offered talking therapies and SSRIs, antidepressants. And neither of those options really worked. I gave them several attempts. So I kept trying them. I think I tried 3 times while I was still serving. And I didn't find any relief from any of my symptoms, or I didn't feel any better about my experience. And at that same point, so I was spiraling out of control from these experiences that I'd had in combat. And it was affecting my relationships, my civilian relationships. And my longtime partner and I actually separated soon after I returned from Afghanistan because of my behavior. I was increasingly erratic and my mind was increasingly frantic. And I didn't have the tools to express myself and how I felt to my partner or to anyone else for that matter, which frustrated me in addition to all the grieving process that I was going through. But then when the relationship failed, I realized I was really brokenhearted at the same time as having grieved for all of my friends that I'd lost in Afghanistan. And I wasn't getting any support. And so I really started to spiral out of control and realized at one point it was time for me to leave the military, even though I'd had an amazing career. I really did have an amazing career. I was very lucky. But it was time to leave. And then I went to work for JP Morgan in the city of London. And I started to experience more anxiety and more depression because the banking industry, as many of us will know, is fairly intense and pretty relentless. And I decided to seek more help from the NHS in the UK and from military charities in the UK, because the way that it's set up is that once you leave the UK military, actually you're in the hands of the NHS and the charities. You're not really a responsibility of the military anymore, and we don't really have an effective Veterans Affairs organisational structure to help. It's more of a political office. And so I was made to revisit talking therapies and antidepressants again, and it really didn't work again. And I was beginning to feel quite hopeless at this point. I was in a very dark place, And it was at this point that separately, two friends of mine who both live in Los Angeles separately contacted me to tell me that they had recently traveled to Peru and had both taken ayahuasca. And knowing my situation, they suggested that it would be worth me giving ayahuasca a go. And because of my hopelessness at that point, I took a holiday from JP Morgan and I went to the jungle, and I was introduced to a shaman who took me into the jungle and looked after me and provided me with 2 ayahuasca ceremonies during a 10-day period in the jungle. And I left that. My experiences were profound, as most people's experiences with ayahuasca are. But I left that jungle understanding absolutely that I'd been healed from my combat experience, the trauma of my combat experiences. I still had a lot of work to do, as Jesse highlighted. A lot of integration is incredibly important. It's fundamentally important. But I still understood inherently that something huge had changed inside me. And so I made a commitment not only to myself to further my own development, my own healing, and focus on that healing now that I had a valid, viable option. But I made a commitment to all of my friends who I also knew that were struggling because we had shared the same experiences. And so it was from that perspective that I thought, you know what, maybe I can create an organization to help these veterans gain access to what I had experienced. But then I found out that Jesse had already done it, and he very kindly saved me from reinventing the wheel in the UK. And we just opened the UK branch of Heroic Hearts. So now we serve not only military veterans in the UK, we also serve emergency services veterans. And we're further back along the path from Jesse and his team. We've got a lot of work still to do, but we have made a very promising start, and it's really excellent work that we're doing, helping these guys out. So thank you very much for listening.
Well, Keith, thank you very much, and for your story and for your work. And we are now moving on. David, might we hear you?
Yes, hello. My name is David Fascinato, and to echo Jesse and Keith, just thank you very much for providing us with this platform, this opportunity to share our stories and to contribute to the conversation about how psychedelic-assisted therapy can play a vital role for so many veterans and for so many average citizens on their path to recovery and their path to healing. About myself, I was in the Canadian military. I served in Afghanistan back in 2010. So I just missed Keith there. But, I have to say my military career was, filled with purpose and meaning. And it was actually a force for stability for me personally. And where I really started stumbling out of the block was coming out of the military and trying to find my footing afterwards. Again, so in Afghanistan, I was in psychological operations, had very meaningful interactions in Afghanistan. But then, within 30 days, I was back in university. I went from patrolling, one day in December to school back in university one day in January. And there was whiplash in many ways. Like most soldiers, I just sort of buried everything and continued along my journey and tried to transition out of the military formally and find a job and find a similar sense of purpose and meaning, but was very much unable to after so much effort and energy putting in to find a new career. And this was compounded by adverse childhood events and things that I grew up with, and unfortunately family situations that weren't terribly easy. And so all this came together in the late 2010s or mid 2010s with my transition out of the military and big changes in my life at the time. At this point, though, I, as a veteran who's transitioning, I was immersing myself in how I could still serve and support veterans in the Canadian veteran community on their journey. And just like a stereotypical veteran, I bury my own issues, but I wanted to serve others all the time. So I helped, establish organizations here in Canada that could repurpose veteran skills in disaster relief, and worked internationally to build a model of veteran-led disaster relief organizations. In fact, speaking in Kyiv back in 2018 about this, these opportunities to sort of, again, take the skills and experiences of veterans and repurpose them for the benefit of individual veterans and communities. And this journey of continued service is very much part of my theme and my own transition story. But underpinning that was myself just kind of continuously burying issues and burying I don't want to say trauma, but just a long history of pain and suffering. So my journey into psychedelics is not a direct one. It was similar to Keith and to Jesse. I knew that there was something wrong. I was losing friends with whom I'd served. Often I would just lose connection with them and then find out a little bit later that they had taken their lives. And this also just started to grind and wear on me. And in the summer and fall in 2020, in the middle of the pandemic, I was connected with someone who asked if I wanted to get Heroic Hearts Project Canada started. And I had no interaction with psychedelics at that time. I had on my own healing journey, a lot of talk therapy. I was able to avoid medications, and having seen a mother who is dependent on medication in her own life, I had a lot of hesitations. And in Canada, the system of care is very fragmented for average veterans. I was a reservist, not a full-time military member. So I sort of fell through the cracks at the same time too. And like Keith in the UK, we have provincial healthcare services here in Canada, which allows you to sort of literally fall in between the cracks sometimes, especially if you're someone like myself who doesn't want to talk about their experiences and their issues, and again continues to bury them. So getting exposed to Heroic Hearts Project Canada and the effort to establish the organization here that Jesse had founded in the US was sort of like turning on a light bulb for me, and allowed me to start thinking about how, not just how I can continue serving the veteran community here in Canada by providing them with the channels and the opportunities to connect with psychedelic therapy in Canada and abroad to help them heal. But for myself personally, it was, a journey of exploration, understanding that, this could play a pivotal role for me in my own healing journey. It was after some critical events that Jesse actually invited me to attend an ayahuasca ceremony in Peru a couple years ago. And, for me, that experience very simply was just, an opportunity to unpack all of the boxes into which I had placed all of my traumas and issues and all the things that I had buried for so long. And walking away from that experience was, walking away without the weight of, 30 plus years of issues that were dragging me down. Integration is a challenge for anyone and everyone, and that's why Heroic Hearts Project exists, is to help people on the longitudinal journey, the long journey of support that's necessary. And my own journey there hasn't been perfect, but it's been meandering along the way. And what is very interesting to share is here in Canada how we're looking to build upon the model that Jesse has established, that Keith has implemented in the UK, is how can we work within the regulated channels that exist here in Canada. Very briefly, Canada has some regulated channels to access psychedelic-assisted therapies. However, they're not perfect. So we are looking to build access for veterans who are seeking out psychedelic-assisted therapy to help them on their healing journey through those regulated pathways in Canada by helping to build on our clinical understanding and the data on the safety and efficacy of psychedelic-assisted therapy, and building on the resurgent interest in psychedelics as a healing modality for clinicians and medical professionals who are overwhelmed after several years of, the pandemic and with mental health systems in crisis, especially here in Canada. So, I'm very much looking forward to, sharing more about Heroic Hearts Project Canada, talking more about our own journeys. And I just wanted to say thank you again for, allowing us to come and share our stories and talk about Heroic Hearts and our mission and how we can build a global movement here and really advance our understanding around the safety, efficacy, and potential opportunity for psychedelics to help heal our communities. Thank you.
Thank you very much, David. And it seems like it was a very interesting and particular story from USA to Britain, then to Canada. And it seems like the next heroic hearts are going to be in Ukraine, guys. Especially from what you were saying, it seems like, yeah, we truly want to join up your beautiful endeavor. Okay, we are moving on. And as we were talking previously, as I said previously, like if John can talk that well about his friends, what can he tell about himself? So, John, please, can we hear your story? That's nice. Thank you.
There we go. My name's Jonathan Lubecki again. I came back from Iraq in 2006, October 26th to be exact. I got off the plane, was given a good congratulations from a 3-star general and a 2-star general. And I went and watched every one of the people I served with go to somebody. A parent, a child, a friend, a girlfriend. And for some reason, my wife, who was supposed to be there, wasn't. So I got in a taxi and I drove to my house and it was completely empty. She left me a light bulb, one light bulb for the whole house. My dog was gone, my wife was gone, everything in the house was gone. And I crawled into a bottle of liquor. And for 60 days, that's basically what I did. And then I was sitting at a bar at Christmas, and I had only had one drink. And I was sitting there thinking about the best way to end my life. And something popped in my head and said, from all these briefings we all get, and we all pretty much ignore, that, hey, if you're thinking this way, reach out for help. So I walked down the street, and I went to go to midnight mass. And they were full because it was midnight mass for Christmas. And I was told to go away with tears streaming down my face. So I went and sat at the War Memorial in downtown Raleigh, trying to figure out the best way to end my life. I decided to give one more chance, and I drove to Womack Army Medical Center, and I walked in and I told them I was going to kill myself. They gave me 6 Xanax and told me not to take them all at the same time because it'd kill me. And they asked if I had guns, and I said yes. They said, well, wake your neighbors up at 3 o'clock on Christmas morning and just give your guns to them and come back after the holiday. So I went home, I drank a bottle of vodka, and I put a loaded 9mm in my temple, and I pulled the trigger. A manufacturing defect in the ammunition is the reason that that attempt did not work. The second time I tried, a few weeks later, was a broken spring. And then I tried to overdose, and I woke up 2 days later. I've slit my wrists twice. That is how I lived my life for 8.5 years after coming back from Iraq. Every day I wanted to die. Every single day, every moment of every day. Couple that with chronic pain, as well as traumatic brain injury. By accident, at a VA appointment, because an intern from the Medical University of South Carolina was filling in, I found out about psychedelic therapy because she slid a piece of paper across the desk and said, don't open this here, I'm not allowed to tell you. And as soon as I walked out of the VA, I opened that piece of paper and it had 3 words that changed my life. And it said, Google MDMA PTSD. And I found out that MAPS was doing a clinical trial in Charleston, South Carolina, where I was living, using MDMA-assisted therapy. And I went through the therapy. I took MDMA 3 times in total, did roughly 8 hours of psychotherapy under the influence each time, about a month apart. And as bad as my life was for that 8 years, my life in the past 8 years has been truly miraculous. I have lived my life as I said when I spoke earlier, this is the reason my son has a father instead of a folded flag. But it also, I didn't go sit in a cubicle or something and still hide from my traumas and the things that would trigger me. I've actually sought out the things that triggered me the most in order to prove to myself and to the world that this works and it's not coming back. I had an incident, had a gentleman who was a landscaper drown in the lake behind my house. I dove in, pulled him out, did CPR for about 20 minutes. Unfortunately, he was under for too long. I immediately called my therapist. My biggest fear was that things were going to go back to the way they were. And they didn't, in part because I sat down with a therapist and I talked about it. About a year after that, there was a shooting in Charleston. I ran towards and tried to save the victim. Again, I sat with a therapist. And just this past December, I went down to the east here in Ukraine to deliver humanitarian aid with gunfire, artillery, and all of that. And it's kind of hilarious because I didn't realize it at the time, but this Garmin watch tracks all my vitals. So I was able to actually pull up my heart rate, my breathing, all those things, you know, when there was gunfire and all these triggers around. And I was very calm. There's actually videos. You could see where I had anxiety, and that was actually when our driver was driving around watching TikTok videos. So it wasn't the combat, it wasn't that, it was, hey, this is dangerous, you might really die right now. And so I had an appropriate response. And, you know, I'm very fortunate and blessed that I was able to go through it. Like everybody else, we have friends we've lost. And one of the big things, there's a lot of things to realize with this. One, we've spent a lot of time today talking about all these different compounds. And we all know there are prescription drugs that can be abused. You know, in How to Change Your Mind, I said, you know, we have good drugs and bad drugs. We've all been taught this. Well, good drugs gave the United States an opiate epidemic, and bad drugs cured my PTSD. So we need to redefine what is good and what is bad. And this is where the context of use and how they're used is the most important thing. Excuse me. So it's not the drugs that fix you. It's not the psilocybin, it's not the ayahuasca, it's not the MDMA. It's the integration and the therapy that you do that actually allows you to heal. These substances open your mind, body, and spirit to a place where you could heal. Because before I went through MDMA therapy, one problem was every time I would get anywhere close to anything, the therapist would say, well, that's all the time we have for this week, we'll take it up there next week. And they never take it up there next week. So doing multiple hours of therapy to be able to just free flow and talk and work through it is extremely beneficial. But also, if I were to break my leg, hopping off this stage here, I'd go to the hospital. They'd likely give me very powerful painkillers. And then I would heal. And I'd do physical therapy. This is the same thing. Mental injuries are the exact same as physical injuries. And one of the truly sad parts is mental injuries are treated vastly different. You're just crazy. And people don't want to help you. I've never heard somebody say, hey, I'm not going to hang out with you because you have a broken leg and you can't walk fast. But also, when it comes to veterans, people assume that combat-related PTSD and veteran PTSD are synonymous, and they're not. Combat PTSD is a part, but you also have military sexual trauma, and you have people who get PTSD simply because of training incidents. If you're in a rollover of a tank and everyone dies but you, you're going to think about that, and you're likely going to get PTSD. And that's an actual true case. A gentleman that I know who's a veteran, never served in combat. He was in a rollover, and his two best friends in his tank crew were staring at him dead, dripping blood, for hours while they tried to get him out. He was the sole survivor. We need to look at these things as tools to help get to the root of the problem. MDMA allowed me to open up and talk about things I couldn't talk about without having a panic attack, without shutting down emotionally or becoming over-emotional, and couldn't process anything, and nothing ever changed. And as far as the pills, at one point they had me on 42 different pills each and every day. Now I don't take any, and I haven't for 8 years. And that's because I took MDMA 3 times, and I did the hard work and the integration. But I can't stress enough how important the therapy, being properly trained, knowing how to use these substances safely and in a safe environment is critically important. Thank you.
Thank you very much, John. You know, it's just impossible to stop you telling the stories. Yeah, and guys, 2 things that I'd like to promote. Do you mind if I promote 2 things? Like, Change Your Mind is an amazing...
It's your show, man. Go for it.
Yeah. So, if you want to expand your knowledge about the topic, друзі, якщо ви хочете трішки розширити...
Friends, if you want to expand your knowledge about the topic, what we are speaking about, then maybe you will get help by the docu-series on Netflix, which has the name How to Change Your Mind. That's a wonderful docu-series which is dubbed into Ukrainian. I watched it yesterday again, and in fact we were discussing with beautiful illustrations the stories which are combined together. Thank you so much.
And do you mind to share your mic with Oleksiy? Ми продовжуємо, якщо можна.
Oleksiy, let us go on, and if I may, your story as well. Hello, dear friends, I welcome all of you. So I'm the military psychologist, and I'd like to say a couple of words, not as a psychologist, but as a patient who had a course of PAT, in particular ibogaine therapy, assisted therapy in the private clinic in Kyiv. Unfortunately, this clinic is closed now, and I don't know any experts who could help with ibogaine in Ukraine. But I need to tell you about my experience. First of all, what ibogaine is. If you don't know, it's a plant, it's a bush, which is growing only in the Western African countries. 3 or 4 countries who try to cultivate them in other countries, but it was not successful. But that's not what's important. What's important is how I got to this clinic. 2015, 2018 are the years when I was officially in the army. I had to bury lots of my friends. I was concussed, and it happened that 2015-2020, I could not deal without antidepressants and the drugs and tranquilizers and even antipsychotics. I always had them as a 15 at home. I couldn't live with that. I couldn't sleep after retiring. If you know that, and the colleagues, my army colleagues have already told about such cases, they can tell that the problems start when you just coming back from the war. You are always in tension during the war. You have the only objective to survive. But when you come back to your life loses all the brightness. You are irritated by everything. People are irritating in the cafe. You are irritated by the peaceful life. So it turns out that I have become a totally antisocial person. I never left my home, and I didn't want to communicate with anyone. There were lots of hospitals I had to get through. And in 2020, 3 years ago sharp, I met my brother-in-arms who had the same issues. And I can see he has fun and he's happy, he's totally okay. How did it help? He told me about the clinic. He told about the clinic which existed, which has the name, the Center of Modern Addictology. And mostly it was focused on the health care tourism, onto the patients from abroad. I saw people from Canada, the UK there, from the United States as well. Mostly all of the people came to treat some of the addictions, but as I tried it on myself. First of all, I had addiction from these medicines. I couldn't live without them. I was trying to live for 11 days without using any of them. And I was just thinking whether I can fall asleep or not. But nobody could believe me. I couldn't fall asleep for 11 days until they gave me this tranquilizer again. And this was the situation. So when I got to the clinic, it cost very expensive. It was costly. I will not tell you the amount of money, but it was like a 5-star hotel. It was created by the templates of the similar Western clinics. By the way, in lots of countries of the world, it is allowed to have such clinics. In some of the countries like Brazil and South Africa, then New Zealand, you can even buy these drugs by the doctor's prescriptions in the drugstores, but all of them are focused on the treatment of addiction, in particular opium addictions. But as for PTSD, which I had, and by the way, I remember the diagnosis. After I retired from the army, my official diagnosis was the organic brain injury, the concussion, and PTSD, and anxiety, depression disorder, and lots of somatic disorders. So about my experience, for 3 days you are getting ready to the procedure with the IVs, you're getting into order, and during the 4th day, in the morning, they give you a wonderful pill, first as a test pill, how your body will perceive it, and then the full dosage. Well, it will not tell you, but in my case, there were 2 grams of hydrochloride ibogaine. For you to understand, that is a lot. That's really a lot. Because in the clinics, in the hospitals, for instance, the shamans in Western Africa are using the roots and the crust of this plant. But in clinic, it is purified. They have hydrochlorines. They have 5 to 7%, but in hydrochloride, they have 96% of ibogaine. This is the dosage. If you take it, it's almost lethal. So you are connected to all of the medical equipment. You have the IV and the necessary catheter. You cannot move. It's very difficult for you to move. And as soon as I felt it, I really did not like it. I was asking when it is all over. I had such an impression that you are dying. I was dying. Well, of course, there were experienced people close to me who were telling, Oleksiy, everything is okay, your blood pressure is okay, you are not dying, it should be like this. But the time was so slowly passing by, and 9 hours, by the way, I was tied to my bed, I was tied to my bed, and in 9 hours, I could not even walk, so they took me to a different room, to the ward. They took any of the communication means from me, any of the smartphones, laptops, or computers, and I was staying alone for the night just to get into this introspection. In the morning, I began to notice, well, almost 24 hours have passed already. Something weird. First of all, I did not have my spectacles, my glasses, but my eye vision was always bad, plus 0.5, plus 5, and I could see that my vision has improved. I could see the trees, so it was a pleasant side effect with ibogaine. I've changed the glasses and replaced them with less effect, and in the morning, I felt cathartic, as if I was born anew. That was hard to describe. Well, you know, the scariest experience before that was during the war. But if I were asked what was the scariest and simultaneously the coolest experience which I gained, was ibogaine. And it turned out that my acquaintance with psychedelics was exactly through the experts of PAT who can tell you that ibogaine is called father. Ayahuasca is mother, ibogaine is father of psychedelics. That's a very strong psychedelic. But what happened next day? I do apologize for taking your time. This is the consequences of my concussion. Please bring me back. But let us tell us about the next day and then we'll move on. Okay, perfectly. So next day I felt happiness and joy, and I've tried lots of things. I was living in London for 4 years. I was into disco culture, if you understand what I mean, and nothing can be compared with that. Ibogaine in blood is staying for 72 hours, but the coolest is that it has a very long afterflow or aftermath. So for about 2 weeks, you're getting out of the hospital and everything really changes. You're looking and perceiving the world differently. People are so kind-hearted. You want to communicate, to love, to be happy. And that was going on for a long time until I had an issue. My brother died. Well, 2021 was really hard for me. So I had an experience when I had to order ibogaine. It's legal in Ukraine, by the way. It's in the gray zone, so-called gray zone. It's neither banned nor allowed, as if it does not exist. So if you order ibogaine by a post from the African countries, you will get the parcel, and the law enforcement authorities will not have any claims for you. Thank you so much, Oleksiy. But let us also remark that during all of these times, thank you, yes, thank you, we are saying that it will come to you, but we're speaking about PA psychotherapy, psychedelic-assisted psychotherapy. I'd like to emphasize on that, to provide integration sessions. Stanislav, if I may, I'd like to hear your story as well. After we communicated with you, I understood that all of those stories have the unpackaging in hours and hours. But recently I was watching podcast with Stanislav. We have Psychedelia podcast in Ukraine for an hour and a half. This was the story with all the details, but let's try to make it shorter, if it's possible. Thank you. Good day. I am sincerely happy to see all of you here, my dear. It's really so nice to have a speech in front of you and to tell about my story. I will not be in a hurry. I will not try to be as quick as possible. I will try to tell as much as of a high quality story, and to give you the message of my emotions and feelings. First of all, I'm so happy that we are doing that without masks, which we used to use during the previous years, because it was awful and unpleasant. I really disliked that. And I'd like to start with the following. There are different questionnaires and surveys which tell us about the future risks of PTSD and different disorders which are awaiting for us. I will not get into figures and statistical data. My position is the following. We cannot know how many people will be affected in the zone risks, because lots of factors are influencing that. But I would like to make a remark that the issues of PTSD, anxiety and depression disorders concern now not only me. This is the issue of each and every presentee, even here, maybe in the future. That is why I would like, when we approach the Q&A session, don't be shy and ask and pose any questions. If they even concern my injuries or wounds, any of the issues which could really may touch me personally, if you think that I will feel discomfort, no. I've already overcome all of that. I've already processed all of that, and I would answer any question you would like to pose. So, in a nutshell, I am a volunteer. I was born in Moldova, in fact, and I came to Ukraine to protect it in 2015. A short remark. Before the war in Ukraine, I was the leader of the movement fighting pedophiles and drug dealers. So during all of my life, I had a very bad attitude to drugs. And I was always getting to a healthy lifestyle. I was into sports and so on. When I came to Ukraine to protect it, I got into Azov Regiment, the armed forces of Ukraine, and of course I had brethren, I had friends at war with whom I have something to remember, and it was really nice to be with them. One day we were injured, we were wounded. That was the first injury. I have 3 of them, but it's not the right to say the 3 of them, because the 4th was the PTSD injury, an invincible one. So that day when we were injured, that was an ambush, and I'm sure that they were waiting for us in the ambush because we were restless. We were constantly striking the enemy, and we were trying to demolish the enemies as much as it's possible. I could see how my friend, who I really liked, maybe even more than myself, I don't know if I may say so, I could see how he was bleeding from his neck. He had an injury, the fragment injury of the neck. I got an injury in my belly and the right leg. And then I lost the critical amount of blood, almost 3.5 liters, as it was told by the doctors. But why am I telling that? I would like to tell how it was, this person was close to me. If I can say it in words, if I can give you this message, when I was in this state, when I was injured, and when I was saved, when my life was saved, I was praying to God for Him to take me, but Ilya to stay alive, because he was better than I was, and I think like that as well now as well. He was really a cool guy. When we went to for reconnaissance missions, how he was thinking, how confident he was, I wanted to follow him. I really liked him. He was the person who I will never forget. Unfortunately, Ilya perished, and death of Ilya was the reason of my PTSD. So before PAT, I did not understand that in fact, but that was the reason, and I understood it and acknowledged that it was the reason that I am blaming myself because of his death. That I am sorry that I couldn't help him. And the state, my state during PTSD, maybe some of you know and maybe you felt anxiety, depression, panic attacks. That is really hard. The colleagues told that it can impact the relations in the families. They influenced my relations as well. I then dated a girl, and I am sure that PTSD was the thing which, to some extent, influenced our parting, that we had to part. After the first injury, I wanted to revenge. I wanted to come back to war, to kill the enemies, and to revenge for Ilya, for my friend. I had a second injury. Anti-tank guided missile exploded close to me. Our vehicle was exploded. There was the rollout by this missile. I could see it with my own eyes. It was scary. It was frightening. So I didn't have parts of my fingers as the outcome. I was concussed. It's not the thing. But what I'd like to tell you about, I did not stop after that. I decided to come back to war. And I wanted revenge. The state which I was in, it seemed to me that I did not fully understand what it could lead to and how I felt. I got the third injury because of the mine explosion. And after that, I retired from the armed forces. And in some time, in half a year, it took place in half a year, I began to feel my first panic attacks. I did not understand what that was. That was during COVID pandemic. And it seemed to me that I was just having COVID or something like that. So I came back home, I drank my medicine, just usual medicine. I thought it was just some kind of a virus, COVID maybe. So I had my drugs, and in 4 days, I was feeling sleepy all the time. And this is how I needed to have this kind of relaxation. In a couple of days, it was a bit easier for me to overcome that, but I was trying to get into sports, maybe to get to my senses, to my shape, but I couldn't. I failed. Panic attacks followed me all the time, and it was really hard for me. I cannot describe that in words. You can only feel that. So I was trying. I understood in some time that I need to get to psychiatrist, so I went to psychiatrist. For a year and a half, I took antidepressants with psychological support, but they did not help me. I was always searching for the way out, how to get rid of PTSD. I really wanted that. And somehow it seems to me, and I'm even sure that the wish to find, when the person is searching for something, he or she will find what he or she is searching for. So this wish is very important in the process. When you know what you'd like to get and you really would like it. There used to be some other factors which also impacted my wish to retrieve, to in fact get healthy. I went to tango with Zoya. She is here together with us. She is having the camera. We danced tango together. She will not allow me to lie. So I'm so sincerely grateful to her that she got me acquainted with my future therapist, PAT therapist. We were going to tango, and then I told her, Zoya, I cannot do that anymore. I would like to get to the hospital. I need that. I cannot survive. I cannot overcome that. And then she told me, don't hurry. Let me get you acquainted with the guy who is dealing with PTSD. Then I thought, well, maybe that's a usual psychotherapist, and we'll just need a long way to work. I didn't have any knowledge then about the treatment of disorders then. I, of course, couldn't defy that. I met that guy, and during the communication with him, because of his confidence I felt, it reminded me about Ilya. When we were communicating with him, I asked him what methodology he was using for treatment, and he said, I use PAT with mushrooms and MDMA. And I was really amazed. For a person who was trying to catch drug dealers and was beating up drug dealers and really severely beating up drug dealers, for me that was really unexpected. I was shocked because there were lots of myths about that. And now I understand that when those compounds and substances were prohibited in the US, now I understand why they were prohibited. And I told him, but are there any scientific researchers about that? Clinical researchers, maybe, is it really working? And he said, yes, you can go home and Google that and you can read it. And as I trust that, and I know English a bit, I instantly came back home and began to read. I began reading as I really wanted to get rid of PTSD. I really was striving to get that. So I was also persuaded by the scientific research that it is really working and working well. So I agreed. I came to the PAT, to Anton. We did it in Kiev. I'm not hiding that. I'm not afraid, as I know that the Constitution will protect me, and I have my own right to decide, to make up my mind how I will be treated. And in our country, the authority is at the people's. We need to claim from the power, from the authority, to make it legal what can really help us. They are our servants, and we are not theirs. I'm not afraid to tell that we were doing that in Kyiv. He's a certified psychedelic-assisted therapist. He had his training abroad, in the university in Switzerland. So it helped me, because I was a bit afraid. I wanted to get to the real therapist, not just you don't know who. So let me conclude. I will tell a bit about how PAT took place, what I understood and what I saw. When I took psilocybin, and then in some time I took MDMA, I understood and I felt my huge strength. As for my feelings, let me tell you, I don't know what's your attitude to that, but I felt that if I close my eyes and let myself go, then I will be speaking with gods. I really felt that it was really powerful. It would be really a powerful experience. And I was afraid. I was scared. And then Anton told me, Stas, you are a warrior, you are strong, and I know that you will be capable to do that. And he said it with such empathy that I felt it. I saw that he really wanted to help me. He didn't take any money from me. He didn't take a penny from me. I think that's very important as well. And I felt that he wanted to help me, really help me. So what happened? I let myself go and I began traveling in the trip. So instantly, you will not be surprised, I guess, or maybe you will. I saw in my experience, I could see Ilya. I could see him at the observation point where we were wounded. He was in the uniform. I looked at myself. I was in the military uniform as well. So he told me, you know, he always said that I had a pseudo hitman. So he said to me, Hitman, you came to see this world, right? Let me show it to you. I told him, Ilya, I don't have a leg. And he said, everything is possible in this world. Poof, and I had a leg again. So we began running to the position of the separatists. That was not a hallucination. That was something similar to a dream, to my thoughts and ideas, to a dream. There was something in that, something like that. So we began running to the separatists' positions. And you know, when the camera approaches, when it zooms in the films, up to the level of molecules, it also delved me deeper into a different world. As you know, a kind of a snowball molecules. I got into and dived into a different world, and I felt that even in this molecule, there was Ilya as well. Because before his death, he asked his body to be cremated. For him to be cremated. And his ashes, well, his wife, who is also a service person in the armed forces, and she was in our unit, she is at war now, that his ashes should be over Kalmios River in Donetsk region. So I understood that he exists, he is present, he feels well there. And he said me the same. What's the sense of your self-blaming, self-accusations? It will not get better for you. You will only make worse for yourself. There was lots of different experience. My experience was huge and hard. And it is still here till this day. I was really afraid for it to vanish. I was afraid that it vanishes. I really felt nice. All my panic attacks vanished after that experience. All of my anxiety and depression disappeared instantly. And I was really afraid, because of some of the beliefs which I had in the past, that I will be drug addicted, that I will had to do that once a month, but I don't want to do that so often, because this experience is really hard. For me personally, I perceived it as a very hard experience, and I was asking my therapist, Anton, will it ever vanish? I didn't want. As I got the toy in the childhood, I didn't want to let it go. I was okay with that toy, and he told me everything would be okay. You will not need to repeat that. And it is like that, it's true. This experience is still with me, in me. And I am not accusing myself because of Ilya's death. And why am I here today? Because I understand that this therapy may save thousands and maybe millions of lives in Ukraine. And I am sure that I need to do that. Many of my friends told me, and they are veterans as well, that you don't need to do that. Stas, in the future you would like to be an MP or maybe to work in the ministry. So you will, in fact, make your ranking decreased. No, I don't think like that. I personally think that I'm doing everything properly. Thank you.
Thank you very much. So Stanislav, so friends, frankly speaking, if we look at the clock, we realize that our session of Q&A maybe has happened inside of us. So we were asking the questions whilst the guys were speaking up, and maybe we found the answers while they were still speaking.
That was a pretty, let's say, interesting experience for you, because you probably did not understand anything that was going on in here, but we were actually sharing the stories, and we, it was impossible to stop it, because probably many answers were found even without questioning anything. And we are extremely grateful to you for actually joining us up in this session. It wasn't Q&A particularly, but nevertheless, could I ask you to say a couple of words of encouragement maybe, or something that you'd like to share, so that we have your last word before we move on with our conference. Jesse?
Yeah, absolutely. And David Fascinato, his internet cut out, so that's why his call dropped. But he's very honored to be here. My word is, if you are struggling, we're finally at a time where there are viable options that are effective, and we are looking into new ways of treating mental health. So it's definitely going to be a new generation overcoming trauma from war and outside of war and just day-to-day issues. So and we're actively working. Hopefully we'll be able to help more Ukrainians and have more of a presence there. But change is coming, so excited to work with you all on that.
Jesse, thank you very much. And Kit, could we hear something from you as well, please?
Yeah, I'll just echo that. We're in a different, my first experience with psychedelics was in 2014. We're in a very different world now, and this is a viable option for people. I know obviously we struggle in our different nations with the legality of these things, but it seems like in Ukraine there are valid options, legal options as well. So, but we can also, there are options for us beyond the more traditional that might not have worked for everyone in the past. So yeah, there's hope. There's hope.
Thank you very much. Actually, guys, we are planning to have 15-minute Q&A session, but we know that you might be busy during this time. If you can join us up for the next 15 minutes. We are about to open the floor for it, but if you can't because of the other appointments, we would understand you perfectly well. So you are with us, yep? Did I get it correctly? Very nice, thank you very much. Що ж, друзі, маємо змогу.
So friends, I know you expected a coffee break, but still we hope to open this Q&A session. So please raise your hand in order to understand that I'm not the one who wants to do Q&A right now. So who wants to make Q&A happen right now? Please raise your hands. Wonderful. Let's hope that it was unanimous. Okay, let us ask 5 questions and then go to the third part of our conference. So if it's possible, please switch the lights on so I can see the hands of people who are ready to ask the question. Okay, friends, raise your hand. Okay, I have a question on the left. Wonderful. So let's stop at 3 questions. So here's how it's going to go. You ask your question in Ukrainian so that everyone could understand that. I interpret into English for our guests who are tuning in online. And so everyone who can grasp the answer and give it would be wonderful. So please do not hurry while asking questions. It would be really good. Hello. I have a question to all the attendees on the stage. And here's the question. I'm looking stories that are like Stanislav story for Netflix, for HBO. And I have a question for you present on the stage. Why are people so hard to contact in order to speak about the experience publicly? Because it's very important for them to be heard. It's what Stas is doing right now, what everybody who is on the stage and who is telling about the experience, it's very important to share this publicly, not only in personal talks, but also on big stages, on big platforms and so on. So my question is, why is it so hard? Why do you think it's so hard for the people to agree to share the story publicly?
One of the issues is not just with veterans, but trauma comes in a lot of different ways. A lot of people don't want to talk about it because of the stigma of having PTSD or needing help. There's also potential legal consequences of getting up and admitting it. And, I'm sure Stas will agree with me here. It's emotionally draining to get up and to do this, but also we're fortunate. Our PTSD is socially acceptable. If you're a rape victim or you have PTSD from domestic violence or childhood abuse, you may not want to get up on a stage and talk about that. So that's one of the reasons, at least for me, why a lot of people don't come forward. Their fear of legal repercussions and also fear of being judged for whatever it was that traumatized them.
Okay, Jesse, Keith, would you like to add something to that?
Can you repeat the question? I don't think we got it here.
Okay, sorry. Yep. So the question is, why do you think people who are having PTSD, who are struggling from PTSD, are not revealing those stories for the general audience?
Yeah, I think it's a great question, and I think it's echo what John was saying. I think it's also a cultural thing, is especially for men in the Western world, we're sort of trained from an early age not to talk about emotions and suck it up and just keep going on. So we have this culture of just sort of suppressing, compartmentalizing. And so I think changing that, where it's okay, it's accepted, and like John said, like you're not going to lose your job. So it's changing the culture, changing the language, but also teaching us at early ages about emotional intelligence. So processing it. If we overcome a lot of these issues earlier on, then it's much easier to deal with later in life. So it's really just reframing how society and culture accepts mental health.
Thank you. Keith, would you like to add something?
No, I've got nothing to add to those 2 points. As I would agree with everything said there.
Thank you very much. Станіславо, я бачив, що у вас було...
Stanislav, I can see that you wanted to add something to the previous comments. We would be happy to hear you. Yes, I'm just going to answer right away. So in my opinion, that's a consequence from those 60 years. The states, meaning the government of the states, they were spreading the myths of those substances that are in reality, I don't even see as drugs. I don't feel any addiction from those substances, and I am sure that this is the consequence of some sort of manipulation of the government while trying to ban those substances, because all of this started from the US, from the Vietnamese war, and this is my personal opinion. Oleksiy, do you have anything to add to this? Yeah, just push it up. But make sure that the microphone is close to you. Can you hear me? Yes. Yes, this is a very intimate moment. There's nothing much to talk about, as Michael Pollan describes in his book. If a person from the past, some Australopithec came to our time, we wouldn't be able to explain many things to such a person and to explain how our reality works nowadays. So this is the same. It's hard to do. It's hard to explain. And every single person who goes through this therapy successfully, like in my case, or Stas or John, everyone here, we want to save the whole world. We know there are substances that can help, and this is a very cool tool. But I spent so much time trying to make this clear to our central hospital that works with the military, and they just said like, oh, you need to be careful with those substances, you can get addicted. So this is very systemized, and why people don't talk about that, they just don't want to, take this upon themselves, because then they are afraid someone's going to say that those are drug addicts. Yes, education, education, and education one more time. Thank you. Dear gentleman, I could see your hand being raised. Is there anything you want to say? Please do so now so we can answer the question right away. You know, the longer it took me to ask the question, the more confused I was getting in what I was going to ask. So probably through the prism of Stanislav. Now, I work in Superhumans Clinic of complex therapy, and this is my personal experience being a team. So for the veteran who lost limbs or few, so the PTSD, is it an aggravating factor or the opposite in order to get treatment? So I'm going to explain myself now. So I got a feeling that there is a hypercompensation mechanisms when you deny the existence of PTSD because you really want to renew your limbs, you want to get the prosthesis and you want to get back. So is it true or no? I'm not talking about the therapy. Yes, this is effective, this is efficient. The only one thing that is left is to create a legislative base for this in order to train all the personnel that is going to work with this. But talking through the perspective of additional factors that can make this process even harder with PTSD. Thank you. Okay, if I understood the question correctly, let me know if that's correct. So if you have an amputation situation, is it somehow making it worse for PTSD? Is it making it worse with the amputation, right? That's what we're talking about. So amputations with PTSD in combination of this. Yes, yes. So I think that in general, amputation and the way you build your attitude towards it and to the events that happen in your life, yes, it can make it worse with PTSD. It depends on your attitude, whether you think about that a lot. You know, we know cases how disabled people are being treated in our country and other countries, and we have a lot of people that are hiding their amputation. They tend to wear pants all the time, or they stay at home and they just never leave. And this, of course, can complicate the PTSD, but I'm lucky. I'm lucky because I had this lady, she was very cool, and I'm still very thankful. And she said, guys, if I see you in pants, not in shorts one more time, I'm gonna kill you. And this lady, she was quite, everyone listened to what she said. And she used to say, you have to be proud of those injuries you got because you got them not while being drunk or something. You got them on the war and you are our heroes. And I want you to see in those shorts at all times. And she was the one who really facilitated this process for me in my approach to my amputation. And I'm really proud of the fact that I was protecting Ukraine, and that's the reason why I got my injury. And I never hid my amputation. I have zero issues with this. So the answer to your question, it depends on how you see this. Thank you very much, and thank you for the question, and especially for the answer. Dear friends, now we have an opportunity to ask the finalizing questions. If possible, please give the mic to this side.
The last question, let's hear it out.
Доброго дня.
Hello. So my question is to Stanislav about your personal experience. You mentioned that you had a session with psilocybin, and you had a very hard release and insight and relief. But then you also went through MDMA session. Why? And was it only 2 sessions or maybe more? Thank you.
Question for Stanislav, and let's hear the answer.
Why, and what was the last part? And did you have any more after the MDMA? Because you mentioned that you were scared that you are going to be hooked up, and yeah. Why? Because the therapist told me that you'd rather have MDMA as well. I would recommend you to do that. Because psilocybin, as you heard before, it's more for depression, and MDMA is more for PTSD. And after the session happened with psilocybin, I felt on myself that this helps, this works, and I didn't see any barriers on my way of trying the MDMA session, and I didn't see any stops, and I just trusted my therapist, and I did so. But that's a separate story, the experience during the MDMA session. But to cut it very short, and it was quite deep. I got some answers for the questions I thought about when I was a kid. I was 6 years old, but back at that age, I was already asking myself some deep questions. Who am I? Why am I here? Why me? What is my call here? And so on and so on. That was quite deep and quite strong. Thank you. Thank you. Thank you very much. Dear friends, let's have a round of applause for the veterans who joined us on this discussion.
For your time, thank you for being with us. You are the truly heroic hearts. Hopefully, later on, when we are having our second or the third conference, we will be more ready for the questions and for your answers. Thank you very much. Панове, ми вам дуже
So, dear gentlemen, thank you.
Що ж, друзі, зараз ми
So, dear friends, now we will have 2 minutes for rearrangement of what's happening here right now, so we can have more space. And we also want to thank you for your attention. We are going to move forward right away. If you feel like you want to get up and have a little, movement and stretch out, please do so. But we understand that some people are going to stay with us because we are going to move with the timing, according to the timing. So, friends, we are going to continue our conference. Again, as I mentioned, we're going to stick to the timing. Please come back to us, especially after 15 minutes. We are going to open our Q&A session. So, yes, can I have your attention, dear ladies and gentlemen? We are not having a coffee break at the moment because, again, we're sticking to the time. If you feel like you need a little bit of movement, please do so. But for those who want to stay with us and stick to the time, then please stay with us because we are ready to be moving forward to our next expert.
Тут мені підказали організатори, що ми все ж таки
Yes, the organizators just gave me information on our break. It's going to be 10 minutes right now. So I don't know how we're going to have enough time for that, but you have 10 minutes and we will be happy to see you back in 10 coming back to us. This is very valuable to us. And we are going to the third part of our conference. And we would really love everyone to have here back. Traditionally, in order to change the perspective. Maybe you want to change seats, maybe you want to try to change your perspective, literally speaking. We were mentioning that we will start from the international experience, then we're going to have the panel discussion with veterans that just happened, and then we're going to go to Ukrainian experts that are going to update us on the current situation. So please take your seats, and just in 1 minute, we're going to start. Thank you very much for coming back to us. That's it. We are ready to continue. And as I mentioned, now we are going to have the closing session with our domestic specialists that are going to update us on current situation on mental health in Ukraine. That's going to be 4 speeches, and they are going to be much shorter than the speeches we heard during the first part, which is quite logical because we're moving towards the closing of our conference. We are going to have a psychiatrist, the chief of the medical psychology, and the representative from the National Medical University, Bogomoltsa. Oleg, can you hear us? Yes, you're speaking very loudly. I can hear you just all right. Thank you for waiting for us. I'm sorry we had a panel discussion and we need to take a break after that, and that's very valuable for us that you stayed with us and you could wait for all of us. Yes, for me as well. It's very valuable that you could wait for me. Amazing. Thank you. So, according to our regulations, we have 10 minutes. If that's enough for you, amazing. If no, then, of course, we can move the time. No, I am a person of discipline. If you say 10, then 10. You said 25, but I can do 10. And if you want me to, I can just skip the slides and I can just answer your questions. Let me start something. I'm going to try to monitor the time, not to violate the regulation, because I am very respectful towards our speakers, and I'm very happy to see certain people here today, because with some we work together with a NATO protocol, and the first month after the terroristic attack there was a guideline which our team was utilized in. So psychedelics, I'm going to start here, but maybe I'm going to pause at some point because there were some questions. Why did you change one psychedelic on another one? What was the need? And I am going to explain something to you. So for me, among the Ukrainian speakers, it was very hard mission to talk about something that is not here, but talk about something that we need. So we're going to start with this part of what we don't have, because a lot of things are not used except for ketamine, and because many people ask for names, but I cannot even give it to them, because that's where we need to go. That's something we need to move towards too, using our experience, because that fact that we have a huge problem is not a secret. And I'm not going to read through the information we all know, but it is quite impressive, the understanding of what we need to do now and how much work we expect in the future, especially that now, given that 90% of Ukrainians, they have certain problems, and we're not talking about any problems, but we're talking about certain disorders, depression and others, and we can foresee and we put some data together, and we can say that PTSD, because of this collective trauma and spreading this information, and now we can, this pops up when we talk about military, right? But this is a separate area. This is a patient from New York Times. As I was the one giving the interview for them, I can have the right of referencing to this picture. This is a symbol, not a symbol, but a real person, a real patient that yesterday we spent 2 hours with, and we were trying to break it down on clinical aspect in order to understand how we can assist this person. I'm not going to go over all of the story, the whole story of this person, but this person has a prominent PTSD with a very deep feeling of shame because of the people that died close to him. And when he is calling his mates, he gets updates on who died, who has fallen, without even him being there. But this person, not only feeling guilt, but also he is making that list longer of the people who have fallen. And every day, just like almost praying, he goes over this list in his head and forming only bigger guilt and feeling of guilt, because the idea of what, oh, if I was there, maybe I could have helped them, and so on and so on. And those names, they grow bigger and bigger. The list grows, and that takes up to an hour to list all of the names. And when I ask, why do you do that? So I don't forget about them. But many people remember, other people remember about this now. And he said, it's very important to me. God forbid I make a mistake in the name, in the full name of the person. And that list is running constantly in his head. And except for that, everything that is connected to the word PTSD, this is clear. And those patients, they have this combined traumas and also having this chronic pains, and something that we are expected to have after the war. This is a huge amount of people that we need to assist, because this is just an exemplary patient, right? This is not him. It's just a person who reminds me by the physical appearance. But you can ask that, have you taken this? Yes. Have you taken this? Yes. And many other substances. And when you hear all of those things and neuroleptics, and we try to start from the beginning in order to understand how we can help him. And statistics, a few numbers that you can see here. So the guidelines, they foresee, guidelines is pretty much the medicine that has some base of evidence, right? This is something that has been tried, that has been proven, and I can just remind you that it has to be updated constantly, because no matter how hard we work, we always have this gap. And whenever we have this first group with PTSD, we understand that it's not effective enough. We cannot help efficiently. And the doctors that just nod their heads and they say, yeah, all of this is correct, but in the end they start combining. And then when you mention monotherapy, they say, have you seen my patient? We need at least 4 different medication in order to work with him. So this is the real situation where you are presented with a protocol as the evidence, and you need to follow it because this is the world practice, and there is this evidence base. And our medicine, it's not always aligned with the practices, and we need to be looking for something new more and more. Excuse me for showing these cute animals that we actually need to put a monument for because they have been experimented on for so many times. So just look at the statistics. The phenomena of American soldiers in Vietnam, 12% were using heroin during the war, but 95% of them, they weren't addicted when they came back home. And the experiment with the rats, so there was an experiment that if you put the rat, give them two waters, one with drugs, another one without it, they would choose the one with drugs. Because also when they communicate, at some point, they can communicate the idea of switching to clear water. Why this is important? Because this shows that this can also affect something, because when you're back to the social life, it can also change something. What do we have? We have something that we don't have in our reality, unfortunately. So the current situation with PAT, it's MDMA, psilocybin, and of course ketamine. First one and the second one, you can see the act in the bottom. You can follow the links and see that most of that is completely banned, and it's going to be perceived as something as like using drugs and drug dealers. Ketamine, yes, but there are so many nuances. So many doctors, they just refuse of working with it because this is quite too dangerous. God forbid, I'd rather send this person to someone else who's using it and who's practicing with it. And this is how we end up with a quite weird situation where we say, please give us the opportunity. We want to use certain substances with medical purpose, and this is very clear what we're going to do with that. Then we have this electronic petition, and I'm gonna move my... So pay attention to these two documents with electronic petitions, the first one and the second one. Again, what we can hear, the common abbreviation and the slang, you know, of PTSD. First is 297, and the second one gets 29 votes. So the society, they still cannot take this word drugs, because this is so much associated with the slang, with this, you know, drug culture, with addictions, with substance abuse, and it only associates with some problems. And that's how we get this quite hard situation. Because people say that, look, the clinical researches are being run, some of them are already finished, and we can see more information when you are talking about psychedelics. Meanwhile, in the world, they talk about electronic stimulation, and they are using it on the base of evidence about neurobio management, and we're always in the back, you know, and we're always the ones who say, oh, wow, but it's only a small part of it. We can just read the guidelines on PAT. Why we don't form the addiction? Again, referencing not only on this article, but I want to emphasize 4 factors why we need to make sure that we convey this message, and we need to use that right after we can go through some bureaucratical moments. It's 4-1. So first one, the dosage is very small. It should be small, and the effect should be, we should get it quite fast, and even when the psychedelic is changed. And also that we need to use the controlled psychedelic, because some of them can be quite sketchy. I'm interested to hear where some of them are from and how they get it, but I can just speak on behalf of some of the experience I had with my patients. Again, I don't use it in the clinics. And the last one is the small doses and the pure tested substance, because we can see by the researches that the psilocybin is very effective, 4 times more effective. because we can see that there's no need on being hooked up to this and do this for a long time. And the key moment that I mentioned while speaking, I'm going to be showing different global researches, and I know that some of the people that are connected to those researches, they're also here, and they had some time to present as well, so I'm not going to stop on this again. I just want to mention and to emphasize that not the psychedelic that treats, but the combination of these different tools and the work with a therapist, with a psychiatrist, that's something that drives the process, because those substances, they help to work with traumatic memory. Oh, and this one is an interesting one. So,
high channel count, scalable time domain functional thing when you have ketamine. So in fact, those researchers are becoming more and more numerous, and they are used more and more. So what do we have as of today? Let me finalize getting ready to your questions. We have some issues. What needs to be done, as for me, in this sphere in Ukraine? First, if you remember the registered petitions, let us allow MDMA and so on to treat PTSD, 29 votes. So we have the population which does not understand and does not differ. What's the difference of PTA and all the rest, and how the medicines can be used? Because any medicine can kill. You can even poison yourself with a vitamin if you don't keep the dosage. So there should be the population awareness as for PTA. Secondly, explanation and busting of the myths and all of the superstitions as for the medical use of psychedelics among the population. Both and the medics. We shouldn't think that the medics are reading American guidelines and thinking how they can get MDMA. No, the medics have the same stereotypes and cliches. And if we overcome that, then we can speak about the training of medical workers. The most important thing, we are doing that much, but it is so hard. Legislative actions and their following steps, like amendments to the regulation of the Cabinet of Ministers, which you know, if you work with a PTA on the 6th of May 2000, with the amendments of 2014, to get there and to impact, and it will really develop them as well. And if we have that, we'll instantly will have the development of this experience, because the use of this new approach to the patients will mean the continuation of the research. And that means that we'll need also the scientific research and treatment centers according to the existence ones. I was trying to keep to this timeline. I hope, though, to comply with the time schedule. All the best to you. Please stay healthy and come follow the links which I showed, our magazine, our department, or my YouTube channel. Oleg, could we ask you to show the web slide or the slide with your contacts, if it's interesting for everyone, because everybody would like to make a screenshot of that. To make it full screen, sure, please. And you know what? First of all, thank you so much that you helped us to come back to the timing, and we still would like to pose a question, which would be really right, because I can see sparkles in the eyes of the audience. So if we've got one question, we can pose one question to Oleg, and then we'll move on. I'm afraid your wording sparkles in the eyes. If you have sparkles, you need to be treated. But still, I am ready to answer your questions. Okay, let us do that. Let's treat them with words. Please raise your hands if you have questions. And if you don't have sparkles in the eyes, if you have... Yeah, let us say curious, okay? Yeah, let us say curious or interested. That's it. Okay, perfect. I guess the person with sparkles left. No, we have a person with the question, please. Good day. Could you please tell, do you see any time limits or when Ukraine can have the changes in this situation? Because you're communicating with the people, you can see that it could be possible in the nearest future or maybe in years No, no, no. Thank you. Thank you for the question. Viktor, right? Okay, thank you. Still, I think that we are getting through a huge changes, which has the name of the war, which catalyzes a lot, both in the education and healthcare and new standards. I think it will take place much quicker. Even this conference, thank you, Ksenia, for the opportunity to meet such respectful people. Even this conference shows that we really are getting into the world standards now. So I think that it will take place much quicker than it used to be during the peaceful time. Even in the peaceful time, we had to get to the parliament trying to adopt medical cannabis for the children with pain syndrome, epilepsy, and so on. And we failed. But I think that it will get now much quicker. Perfect. Thank you so much. Oleg Chaban was with us. Thank you, Oleg. Thank you. We do hope that again, next time we will be able to feel that personally and tangibly and live. Let's move on. Our following speaker, who will be online as well, is the Doctor of Medical Sciences, pathophysiologist, geneticist, and also the head of the Department of Pathophysiology of the Institute of Physiology, named after Bohomolets of the National Academy of Sciences of Ukraine, Viktor Dosenko. So let's meet him with a round of applause. It will be nice through Zoom, but still. Viktor, are you with us? We are still setting up the connection. We have the proper darkness, so this is the first step already. That's when I was courageous enough to ask Oleg to make this presentation shorter, to have this pause, to have this dramatic break. But you know, something very full of sense and substantial can be born out of these pauses. So let me tell you, dear friends, that this speech will be shorter in comparison with what was planned, because we'd like to come back to the time schedule and finalize the conference as it was planned till 5 p.m. to have an hour to get networking part. But considering the dynamics during all of the breaks and pauses, people are getting acquainted, finding common grounds, and revealing something new for themselves. And I think there will be more questions and answers. We need to get in touch with Viktor Dosenko now, right? Yes, I'm here with you. Good day. Perfect, Viktor. Hello. We have such a situation here. We are a bit out of schedule. So if I may ask you to be a bit shorter for us to come back to the timing, it would be really valuable. Yes, sure. If it's not a hallucination, then everything will work. And I'd like to welcome the organizers, to greet the organizers of the conference for the activity, which I observe and follow since the very beginning, almost since the beginning. And during such a short period, less than in a year, we have such a level of the international conference, which is really a huge achievement, and I greet all of you with that. I do hope that all of the PAT and psychedelics will have better future than cannabis medicines, which are still not legalized for medical use, in spite of all of the efforts of wonderful people as well. And a separate gratitude and a huge welcome goes to the director of the Center of Lisova Polyana, Ksenia Voznitsyna. Ksenia, just for you, I'm sharing the screen.
Мені це дозволити. Обираю. Обираю ось це. О, і ви бачите.
So you can see hallucinogens during mental health. In mental health. Of course, this data is not Ukrainian. Unfortunately, I will suffer together with you, you Ukrainian academics. Thanks to our authorities of all of the generations, we cannot conduct tests and researches with these substances, even in mice and rats. Viktor, can we ask you to make it full screen for us to see the whole slide? Does it work now? Still not. Okay, just a moment. Now I have such an opportunity, and now you will see it full screen. Like this, right?
Так, ну ми бачимо ваш екран, але презентації якось.
We can see your screen, but we don't see your presentation somehow. You don't see my presentation? How come? Last time everything was perfect, you just needed to push the button full screen and then it would be really cool. If you just bring it back, we will figure it out. Weird. Okay, let me try. I have the presentation here. One more attempt then, just a moment. I'd like to mention that all the participants of the conference have a wonderful imagination, in fact. In any case, we will cope, even if you will just be speaking, but if you still cope to share the presentation. Now I understand what's the thing. You wanted to show it just for Ksenia. And we have huge number of people here and witnesses. Victor, we would ask you also to unmute yourself, because, and now we can see it, and we will find you the button of full screen now. Friends, who has the better eyesight than I do? Is it from above or from below? To the left from the cross? Semi-professionals tell us that it's to the left. Wait, they say that you can push the button of F5. F5 seems to mute you. Victor, please unmute yourself in Zoom and let it be like that at least. At least we'll understand the direction of your presentation. Unfortunately, we do not hear you. Seems like you muted yourself, muted the sound on your laptop. But again, the audience is well trained and they know how to lip sync. Victor, we have some technical support here. Guys tell us that at your keyboard, closer to F5, you should have one more button which has a kind of a loudspeaker drawn. Right. Oh, sorry, that's why I pushed it. Now you can see it and you can see the presentation. Well, yes, we can see you. So far we don't see the presentation, but at least we hear you and it's much more important, you know. How come? Okay, I don't know. Okay. Let us go on then. But as for my presentation, it seems to be launched. And this is how it looks. That is weird. We never know how the rise of machines will look like. We just imagine some Terminators, but this is how it looks like, in fact. And now you don't see my presentation again. No, unfortunately we don't. We just see a black screen. It's a promising one, but it's black.
Що там технічна підтримка скаже? Не знаю, я демонструю.
So what does the technical support tell you? And technical support tells us we would listen to Victor without a presentation. Here it is, in fact. Now we can see the presentation. Perfect. You see it? Yep. And if you push the button of F5. No, don't do that. Okay, don't do that. Don't push any buttons. Well, we have the presentation and I'm really short of time now. But what do we need to speak about? We need to speak about the mechanisms, in fact. It's not just a game. Those are the medicines and the substances which are well, in fact, thousands of academics are investing their efforts and time to understand the positive development of treatment of PTSD, depression, and other pathologies. And a huge success, let me repeat, was gained by Ukrainian academics, but unfortunately they cannot join these festivities, both for MDMA and ketamine and LSD and psilocybin. And there are molecular mechanisms. This is how they act. And if we focus our attention on MDMA, you can see that there are no serotonin receptors there, though for me that was very expected. But this is the fresh review. The main mechanisms of MDMA actions are connected with different things. So we started the brain structures, not only receptors, but the brain structures which increase or decrease the activity while having the impact of hallucinogens, so-called hallucinogens. Hippocampus and the pretemporal core, and this functional connectivity increases, and we have this increase of the inflow of blood if we speak about the active functioning in the zone. And in amygdala we have the decrease of that. If you don't know it, the amygdala is fully connected with fear, with horror, which is dominating among the people with PTSD, and so on. During that, different mechanisms of the molecular level, we are achieving the needed effect, decreasing the activity of the brain zones which are responsible for fear, death, horror, and some of the worries, and we are increasing the ones which give you the feeling of joy, harmony, happiness, and so on. And this is the most probable mechanisms of action of MMDA or effect of MDMA in the central nervous system. It is taking place with the brain-derived neurotrophic factor, and you can see how it is increasing. Well, of course, with the help of serotonin action. But BDNF, in fact, provides this needed reconstruction of the central nervous system and the creation of the new connections, so links. And BDNF is a neurotrophic factor which provides the shaping of the contacts between the neurons. And the BDNF exactly is decreasing in the brain and in the blood of mice and people with PTSD. So anything which increases the BDNF level will be helpful and treating having the PTSD. When we measure this factor, it's really reasonable even now for our heroic warriors to get to know what are the injuries of central nervous system, which is the source of neurotrophic factor. But not only BDNF, oxytocin. MDMA is really actively interacting with oxytocin, and this is the publication which was very, in fact, famous, because thanks to the impact of MDMA, there is the increase and this reopening of this window for social award for the studies, what we can feel as a good hug, as a nice view, as high five, everything will work, and so on. all of that is giving inspiration and support for the healthy people, but for the sick people, it's vice versa. For them, social support becomes not accessible, unaffordable, and at the level of the experiments with the simplest animals, we can see that with the help of the hallucinogens, we can achieve this additional opening of this window and to replenish social interaction. Those are very subtle and deep experiments, and we don't have any reasons to doubt in them, as well as in all the other tests on animals. And that's what I'm doing, in fact. I'm emphasizing your attention on the experimental tests and researches as the pathophysiologist. People, unfortunately, are lying. People are deceiving each other with certain objective or just like that. But the mice don't have any wishes like that, and they can't have any wish to deceive. That's why we get an objective information out of these tests on animals. And you can see through the nucleus, MDMA was injected into the brain of mice, and there were certain changes which allowed to say that these mice were becoming more dependent and addicted to the contact with other mice, with different mice. They needed the social interaction, which is helping during the treatment of PTSD and depression. There are certain works on modification of MDMA molecule to improve its efficiency, and as you can see in the name of this article, to separate agony from climax. Because the neurotoxic effect really is there, it is well proved, and this dependency needs to be avoided, and we need to get the best possible result. And in the future, undoubtedly, these or other similar substances of MDMA will be introduced into the clinical practice. I do hope that then the conscious of the people, of the decision makers, will wake up finally and will allow the medical use of these substances. One more article, which is really fresh, of 2023, the group of Japanese academics and scientists proved that the injection of MDMA during the 10 days to the mice will decrease the probability for the development of chronic stress. And also it impacts through the microbiome, which is incredibly unexpected, as for where we can see MDMA and where we can see microbiome, but they are acting separately, but still they are interconnected. They are interconnected because the impact of the MDMA can influence the immune system, and through immune system it can impact the interleukin-6 production or other indicators. To the right, you can see what's the difference and what's the increase of the size of certain parts of the body of the mice with PTSD without MDMA, and MDMA, which brings back this body organ to the initial state. And we studied the blood, and we can see that this composition is changing during this social and stress, and it comes back to the initial state under the impact of MDMA. Victor, just a moment. We still have the first slide on screen, but something tells me that you can see slide 5 or 6 already. We don't. So if I may, could you please show us further slides? How do I'm always changing the slides. What's happening today? Well, sometimes the equipment is not helping, but it decides to harm us and provides us with hyperfocus. Here it is. Thank you. So you ran through all of the slides. Now, this is in fact the slide, the one before the last, which reveals the new mechanisms of impact of MDMA onto the body of the mouse. And the same impact will be, I would say, seen among the people, the humans, and when we can see the psychological diseases, this is a separate focus of the attention, which is an incredibly perspective topic. And of course, the scientists and the academics decided not to stop on the mice. They came to the clinical level, and at this study, you know, maybe this article, this is the Nature Medicine magazine, and this is the result of the phase 3 study for the randomized double-blind placebo-controlled test, where the participants could be of the Ukrainian psychiatrists could be used as well of the psychotherapists and psychiatrists. But no, this research was conducted in a different country, and during these tests the people got certain help. And it can really witness about the efficiency of MDMA-assisted therapy while treating the severe PTSD. I thank you for your attention. I do apologize for technical issues, and I do hope that this activity, this movement will lead to certain effect. Thank you for your attention.
Thank you very much, Viktor. So we have an opportunity right now to take one question. If you don't mind answering the question, that would be amazing. Yes, of course. That's exactly why I am here today. I love answering questions. I adore this. Amazing. So, dear friends, traditionally, I would like, yes, I can see the first hand. Please, if you could pass the microphone over to that person. And that's the question. Yes, hello. Thank you for your speech, Elena Lander, Gestalt therapist. So I'd like to ask, if those substances, they become legal here, so from what researches you would start, from your perspective as a researcher? Indeed, my main focus, and other specialists I think can share my opinion, would be the PTSD, because we are in the epicenter, and whatever we do, we will still end up with a big amount of issues on this side with this syndrome. And this is, according to our realities, this is something that we can work with, but it's not perfect, and the treatment is not perfect. We need to increase the effectiveness and the experimental therapy of the PTSD. This is something I'm constantly thinking about. Thank you very much. Viktor Dosenko was with us. So, we are going to hope that this tradition with having our experts and specialists is going to stay with us. I'm not sure when the next conference is going to happen, but I can officially say that all of you are invited. I just looked at Ksenia, and she gave me a nod that yes, I can do that. So, dear friends, now we're going to move to the next speech that is going to happen here live, with the opportunity to talk in person. Candidate of Medical Sciences, psychotherapist, and founder of the XPO Center for Psychotherapy, Vladyslav Matrenytskyi. So, please, you may begin. Everything is ready for your speech. Thank you. Hello, dear friends. So today we have talked a lot about PTSD. Yes, you just need to turn it on. Yes, okay, I need to turn it on. Turn it on. Let's help me a little bit. You probably already understood that I'm the chief here on this matter, on different technical aspects. Everything worked amazing. So, We spent a lot of time talking about PTSD and why we need some new methods of treatment, and I just wanted to complement a little bit from the perspective of psychotherapists. We need to understand that the thing is not only with PTSD, but up to 60% of psychiatric patients, they have some complicated forms of this syndrome, and those patients, they do not respond to standard treatment, and they need to be looking for something new. That's the same problem with PTSD. And in order to get this stable remission, you can only reach it in 20–30%. If we come back to the military topic, that according to the US researches of the experts there, approximately 15–20% of veterans, army veterans, they have PTSD that cannot be treated, and more than half of them are getting depression as well at the same time. And again, if we're going to try to put it on our reality, and we're going to try to rely on the numbers that are official, 700–800,000 of our soldiers, I think we can expect approximately 30,000 of people that are going to have this syndrome, and we don't even know what's going to happen with civilians, but the statistics shows us that it's probably going to be approximately 10%. But it's clear at this moment that we will need to have a new approach. A lot of the times, what was mentioned today, that we have main three candidates is MDMA, psilocybin, and ketamine. And among those, ketamine is the only substance that is legal. Why is it legal? Because this is something that is used in medicine starting from 1962, and it was used by the surgeons. And in Ukraine, as in many other countries, this is a very serious thing, and it's very accountable in its work, and it's limited on the amount, and it can be only used in medical institutions and clinics, and not even in all of them, but only those can use it that have appropriate documentation, and they're approved to use it. But for the last 10 years, we learned that it can be also used off-label. And in the practice of, it can be also used for psychiatric purposes and neurological. It helps with PTSD, with obsessive-compulsive disorder, and with some chronic pain syndromes. It could be migraine or others, because this is important, because the mental element is very big in this. So also something that is interesting about ketamine and different, it's the duration of its effect. So MDMA works up to 4 hours, and ketamine, so from the starting point until the end point is 2 hours, I'd say, and the session itself is approximately 40–50 minutes, which is a good thing if we talk about saving some budget and resources. So this is quite attractive. So usage of ketamine in off-label format started in 70s. In 62, again, it was opened, and with some time, anesthesiologists and surgeons, they started noticing some strange state during their work of the patients, and they started working with that and researching. And in the middle of 1970s, they ran some researches for the ketamine use, and then it happened for treatment as well. And closer to our decade, they started research on using ketamine as anti-depression means, and which is now probably the most popular usage of this substance off-label. In 2012, the first ketamine clinic was found in California. Then in 2018, we did the same in Kyiv. And in 2019, FDA, they approved using ketamine as nasal spray for depression treatment. And before that, mostly it was used through IV or directly to the muscle. And after 4 years, but still there are many questions towards the spray, talking about the whether that's the best option, talking about the price, because one bottle is $1,000, and we still haven't seen any proof of this being more effective than a regular IV or so. And this topic is getting developed, and usage of ketamine and researches is developing each year. Just last year in the US, they had approximately 100 clinics, and then few others in Europe and other countries. And as for the effect, it has some neurophysiological effect, and this is connected to the fact that there is a whole chain of intercell mechanisms. But the most important part that it's the glutamate driver, and that brings to the different reactions that are happening, and that brings to synaptic plasticity, and it strengthens the neurocirculation and stops the. And talking about the psychological impact, this is something, as other substances, changes the state of consciousness and helps us to work with this, because the patient is getting access to their subconsciousness. And this is a dissociative psychedelic, ketamine. It brings you to a state where a person feels like the subconsciousness is getting detached from the body, and it almost feels like a separate consciousness. And the bigger the situative effect in this spike feeling, the bigger the therapeutic effect is. And one of the founders of PAT, he mentioned that ketamine is non-specific tool to strengthen the subconscious processes. So this is something that we're working with. So the treating process, what does it look like? Pretty much the same with the clinical studies that are being run at the moment. So you need to meet up with the patient to do preliminary research and to understand the situation. Then you need to have a session with the person to understand how his mental health or her mental health works. Then we need to run some tests. We need to check some vitals, and this is important to work with the patient on the side of psychotherapy before and after. And this is very important in this process, because we're using this changed state of consciousness in this process, and we can get access to those traumas or conflicts that are usually suppressed and not even noticed by the patient and realized. After the sessions, we move for integration session. we meet for this session, and then we talk about insights, what has changed in the state of the patient, and what is the therapeutical result. And those we can have 4 to 8 sessions. It depends on how severe the state is and the abilities of the patient. So talking about this effect, antidepressant effect, most of the times, right after the session, patients, they notice the decrease in their depression level, and some people can have it develop through hours and a day after the session. This is something we call a fast effect. And a late effect can be developed within 1 week after one session, or even after one session. This improved state can stay up to 1 month. If we have a course of this treatment, and this result can get consolidated and then can stay for longer. So David Nutt, this is something we mentioned before today, and we can see the ketamine is somewhere here among different other psychedelics on this chart of potential damage, and it's gotten 15, a score of 15. And we cannot even compare it to some other popular drugs like crack, heroin, and alcohol, which is 70-ish here. And the smallest is psilocybin. So what are the risks of using such therapy? As well as everywhere else in medicine, you need to do screening. And you need to make sure you know everything about the patient. You need to make sure that there are no factors that would stop you from running such treatment. You need to understand that a psychotherapist needs to know how to work with a changed state of consciousness, because if this is unknown to the expert, then during the procedure of this therapy, getting this therapy, the person opens up and opens all of this inner conflicts and traumas. This can lead to bad trip, as they call it. And this could be very bad, because while being conscious about all of those inner issues, and if you work with it in the wrong way, that could bring some very bad outcomes. So we are creating that bad trip artificially, and we're changing it to a good trip, so to say. And we need to have the assessment of psychiatrists and psychologists in order to track the changes from one session to another session, so we can adjust the process, maybe the speed, the interval between sessions, or the dose. You need to understand how those drugs work, and what is allowed to have in parallel with ketamine, what is better not to, and what is forbidden. By the way, ketamine is works good with almost all the antidepressant drugs. And the thing is, another problem is the lack of training and accreditation of experts, because we need to understand that not every expert is ready to work with these processes. And again, talking about stigma, because before the conference, when I was trying to spread this information, the moderators of Ukrainian Union of Psychotherapists, they didn't even want to post the information on this event, because this is something that has not been proven yet. And you see, if they're so biased, then it's easy to imagine how the society can take this. And of course that the lack of psychoeducation about the ketamine use and effect can also be a problem. Talking about addiction, because some people may think that where are the good things about it? When do I start feeling amazing from that drug? But I just want to point out that in order to get the addiction from this drug, this is not that easy, because normally it takes someone to use it for a very long time. And if we're talking about a course for 4 to 8 sessions, then this eliminates any threat of having addiction in the future. And because our central topic for today is PTSD, the question is whether it works, ketamine, for PTSD. The answer is yes, it does. Approximately 30 studies were done, different diverse studies, and last year they ran a few meta-analyses, and in one of the studies they picked 14 articles that were showing us that ketamine is a prospective and promising method for treating PTSD. And just 10 studies were included, where 705 patients took part in, and they proved that ketamine can drastically facilitate the symptoms of chronic PTSD. And we're talking about some post effects. It's blurry vision, some nausea maybe, but I think we only had that one time when someone actually threw up. And so some side effects are there, like dizziness. Normally that goes away within 1 hour, or in 1 hour, doesn't need any intervention, and happens not to every patient as well. And there are also there's data that when you use ketamine in parallel with psychotherapy, you normally reach drastically better effect in the end. Some clinics, they only use ketamine, they do infusion, and then they say, well, now you can go to the psychologist or some expert, and then you continue working with this. But personally, I can say that this is not the most effective way of working. Our experience, starting from 2018, we have run approximately 500 successful sessions with ketamine therapy, and normally it's psychosomatic disorders and PTSD cases, and they were responding quite well. For example, just recently in private, I worked with a few soldiers. Why in private? Because maybe you know that the active soldiers, they are limited to only military healthcare system, and they don't have the right to go to someone else, especially the private clinics. So whenever they need to get treatment, they are looking for some opportunities, I might say. And we had a successful outcome. So the legal base for using ketamine is basing on the norm of the Ministry of Health that allows us using some foreign protocols, and that's what allows us to work with this. Our experience shows that a third part of the patients, they show very good results after fourth session. We can see the decrease in depression syndromes. Another third part, 1/3, has the results somewhere in the medium level, and the other part I would probably compare to using antidepressant solutions. And of course, there are some people that do not respond at all, 4%. They do not respond at all on ketamine treatment, and we need to have more studies why this happens. And some of the data on the baseline about the effectiveness working with this, with PTSD and combat burnout. A lot of people, they start drinking in order to help themselves with the stress and cope with stress that they brought with them home. And we had few cases where military people, they were coming to us, and that helps to restart, I'd say. For example, a real life case, a volunteer from Belarusian battalion. They're very limited with very strict rules, and they're not restricted, excuse me, with the rules like the armed forces of Ukraine. And this soldier got under shelling, and almost everyone died from his battalion, and he came out of that operation, and he was in quite severe state, psychologically speaking, and he had no desire to go back to the front. And after working with him, well, we can say he rebooted. He got back the desire to the desire for revenge for his mates, and he wanted to continue fighting. So we understand that legalization of MDMA or psilocybin is going to take some time, and how long it will take is unknown given the situation. But today we need help, and today we need to use the therapy that is going to help our soldiers. And we can, by using our experience, we can run some clinical studies for veterans with PTSD. This is not limited. They're not limited with a selection. If we have some representatives from veterans or from this group, we can try do that. And for active soldiers with combat burnout, this could be a very effective help to those who have these problems. Another aspect, this is not on the level of clinical studies yet, I'd say on the level of some clinical cases, but I can also prove this because we had some stories of our own. Some people had some accumulated stress, but not on the level of a burnout. Using some proactive means helps reducing the accumulated stress and maybe build the resilience, the stress resilience a little bit. And I think that this approach towards our soldiers could be quite efficient, and I think this is a prospect of work for us. And if this study works and we can show that yes, this works not only abroad, but it's not about having some special people abroad, but in our reality this can work as well, then we can implement this in military hospitals and be able to help our soldiers. Thank you for the attention. I'll be ready to answer any questions.
Thank you so much. And according to the very nice tradition of the second part, we have the opportunity to pose one question. So now we need to define whether we have this question or was everything very exhaustive. Oleksiy, please, the mic is yours. Hello again, dear friends, and Vladyslav is the person I had therapy at as well, and it helped me. I forgot my question, what I wanted to ask you about. Oh, here it is. So I personally, for myself, I divided or bisected the psychedelics into two categories. We were speaking about that before your lecture. That they can really take you out of the war. That's really true, and according to my experience and the experience of my brothers in arms, they may tell that. But the war is not over, and Ksenia knows that that the guys getting even here, they get to war back. They back to war, and we know that many people died at the combat field after even the treatment. So, as we said, shamans in different cultures are taking the war out of you. But when you are sent to war, which psychedelics could be the most helping for our soldiers, for our service persons to reboot them, to motivate them when they are coming back to the combat zone? Well, it depends on the state which the person is in. If we're speaking about not about the people who need treatment, PTSD or depression, or the patients who are having treatments of concussion or traumas or amputations. Of course, they have these piled stress, and their psychological state is different from the service persons. So I think that here we again need something of the short effect, maybe ketamine or DMT, because they're also a short-term effect substances. So it would give the opportunity for these people to go back to war in the better psychological state. Well, of course, it's obvious that here in Lisova Polyana, the team of psychologists is really helping a lot to get rid of the stress and to get ready for the comeback. But if we could add this kind of treatment as well for the brains and for the deeper reboot of your psychological state, it would give the opportunity for the people, for the servicemen, to get back to have this better durability and resilience for in the further combat actions. I'm sure that it could help them to really better, in fact, to show them and to do what they need to do at the battlefield. Thank you so much, Vladyslav Matrenytskyi. Vladyslav, we thank you so much, and in fact, we need to finalize the meeting. There was a question, right? A comment. Could you please take the mic? Here we have a comment, and that's just wonderful. Well, that's a question, in fact, to Vladyslav. Could you please tell, you're saying that we need to use these medicines for the servicemen to decrease the stress level, but how do you make such conclusions? According to what do you rely upon in such conclusions? First of all, I do that analyzing scientific and academic literature. Secondly, according to my work, to our work, I can see how it is working. Not even for the servicemen only, because as for the military, I have not that rich experience. But if we look at the patients who are coming to us with non-military traumas, because PTSD can be developed because of the family issues and traumas, or something, the loss of a closed one. So these psychological and mental injury can really impact the state of the person. We are actively working on that, and I can see the changes in the state of the person. The duration of the sleep and the capacity to work and so on. So altogether, the psychological and mental state is improving. So I think that we can expect the same. At least we need to try that out. And if it helps, that would be really nice as a kind of a help. I would just like to appeal to us to stay within the academic discussion. And when we speak about the acting serviceman, we are not speaking about PTSD in the majority of cases. Yes, that's why I separated those notions. When we speak about the possible clinical test, PTSD is more the thing for the veterans. But as for the active servicemen, this is the military or combat burnout. Okay, thank you. Thank you so much. So, dear friends, in fact, Before the final part of our conference, let me really express our gratitude, and that is why. First of all, we had this trip. I would say that it was the trip, a kind of a trip during the last 8 hours. We said that the trip cannot take place for 8 hours, but I'd like to tell you, dear friends, that during the usual conference, where we don't have these complicated topics, 8 hours is enough. But in our conference, 1 hour is considered to be 5. So you have now 40 hours without the sleep, and now we have the final 15 minutes before we can gradually integrate all of this information into the interaction and networking. So I think that you have still force, and do welcome with a round of applause the chief therapist of the State Institution of the Center of Psychological and Mental Health and Rehabilitation, Ksenia Voznitsyna. Where will you stay? Will you join us on stage? You'd like to stay down there? Okay. But just, would you give me the clicker, please? Dear friends, oh, it is so bright. Still, I'll need to get to the stage, I guess, because I don't see you because of the lights. You will be amazed, but when you're up there, it will be the same. No, I'm going back. I'm down. As much as it's convenient for you, please. Okay, it's nice here. Perfect. Friends, my speech is the final one, so there were lots of information here, and it's really cool and high quality from the unique experts, from the pillars for the research of these topics. So I'd like to conclude it, to unite all of that, and to make this final kind of resolution, and to say that really which developments we have and what we'll do further on, and what exactly we need to do. PAT or not PNT, to be or not to be. This is how we are speaking about why we used to be the initiators together with a wonderful NGO, UPRA. Thank you, dear colleagues, for your crazy work in the preparation of this conference. That was just fantastic. I'm delighted. That was so beautiful, like we like it, as we like it. And why we exactly? As 9 years, this is the 10th year, it will be the 10th anniversary in the summer when the whole staff of ours is working with our unique people who are protecting us for the 10th year in a row. We are working with them daily, morning till night, but sometimes during the weekends. We are not working with the civilians, almost. The veterans, the servicemen, the members of their families are our 10-year investment. And as I always say, this is our kind of superpower. This experience which allows us to speak about some of the points intuitively at some of the subconscious level, and we are living with these people together. We are living through their traumas, we are living with their lives, and we can see what's necessary for them. We can see what they don't need, we can see what they really would need, and that is why PAT. I will not delve deeper into that. I have several slides about the figures, but there is a predictable figure of the people who will come back from the war. That's approximately 1,800,000. That's not about the people who are now from the armed forces. Those are different units there, and this is the predictable figure. 3 million are the family members of the deceased. A huge circle of trauma, which you can see here. There will be much more people there. And the experts of the first responders, the rescuers, who can see lots of deaths of the relatives or close people of the Ukrainians. We shouldn't forget about them as well. I wouldn't even speak about PTSD. It would be, in fact, sorrowful to speak about that. 3 interesting figures about PTSD. Only 40% of the people with a severe PTSD are fully recovering. The rest still have certain symptoms for a certain period of time. 30% of people with depression are resistant to therapy. This is the academic data, and 36% This is the research which witnessed about plus 36% of economic benefit when we use PAT in comparison with the classical conventional therapy by antidepressants or psychotherapeutic therapeutic sessions. And now from the figures, let me come back to our practice, to our 9 years of work. Our mission is always to speak about the Ukrainian context of the war. That not all of the practices and what is done in the world, in the veterans and servicemen community, suits us, because besides the huge amount of stress-associated disorders which we have because of the war, where the people are, a huge amount of work is added, complemented, because of the number of the people who lived through the capture or tortures is also unprecedented. And the data the unofficial data, of course, witness that there could be up to 10,000 of such people in Ukraine. That is a very high indicator for Ukraine. And we also have their families and children. This is the huge number of people. And the post-commotional syndrome, this is our well-known concussion. This is the autograph of the war. This is our specifics. This is the epidemic of Ukraine. An unprecedented number of artillery weapons used by Russia is just amounts to huge numbers. And almost every second person, or maybe even every person, has the acoustic trauma or any other trauma to this or that extent. And this organic component is added to all of the psychotraumatizing events which make a Ukrainian aspect very typical. And several more points which are witnessing why our trauma is a kind of a polymodal or multifunctional, multifaceted, the hybrid character of the war, which adds to traumatization as well. The civilians in the army. It's not a secret for anyone that in 2022 we didn't have such an opportunity to provide the necessary number of people, and we have the non-professional military in the army, the teachers, the IT guys, and all the rest. And the duration of the stay at the front line. Everybody mentioned about how the rotation should take place. It should be for 2 or 3 months, every 2 or 3 months, what is done in the NATO-like army. People cannot stay for the front line for 11 or even 8 months and more. Those are additional factors. And the relatives under danger. This is what my favorite psychotherapists are speaking about. We are at war at our own land. And if the serviceman is in the tragedy zone, in the war zone, if he couldn't take his family to abroad, he is still worried for his relatives, and he sees them sitting in the bomb shelters and living through the missile shellings, and he worries for their family relatives. That's an additional traumatizing element. And as I mentioned, the war on your own land. This is both the advantage because we are fighting for our own, but it's a disadvantage because for instance, the combats can take place in the kindergarten where your child used to get to, or in your native city. You can see the destroyed objects and ruinations and what your neighbor is doing with your land, which is also adding this traumatizing experience. Deoccupied territories, when we need to cleanse them, when our military have to get to the deoccupied territories, and again they can see deaths of non-military, not the military losses, but the deaths of the children and the women whom they need to just to help liquidate and I think that you will all agree, it cannot add any optimism to the current state of the person. The guilt of the survivor, as we said, how the demobilized persons are still feeling this guilt because the war is still active. because we can see that there are additional traumatic elements, and if we manage to stabilize the person in a couple of months, all of that can repeat because there will be more losses, more missile shellings, more danger. And my favorite organic component is about our concussion. That is the organic brain injury, which is really making the classical behavioral therapy more complicated, because when the person lacks resources to provide the behavioral therapy, and I took it just an example as the evidence-based therapy. And we need to do it differently. Not like it is done in a usual hospital with usual people. As I already mentioned, our slogan is the best for the best. So we're using the multimodal model for help. So it includes the evidence-based approach in the world, but for many years there is the much more progressive approach, which is called evidence-informed approach, which besides evidence practices needs to use the wish and the preferences of the patient. What would be convenient, more convenient for the patient. And thirdly, the doctor's experience, the intuitive experience of your doctor's practice. The second point, we need to use biopsychosocial model. In our center, you can see that in spite of us working with mental health, without the work with the body, without the inclusion of the social component, we will never achieve any outcome. The next point is the integration approach, when we need to add to the classical psychotherapy and medicine and drug treatment, we need to use complementary methods, neurofeedback, and also mindfulness, physical rehabilitation, art therapy. This is the complex which allows us to work with the person from all of the perspectives. And why do we need new approaches? PAT, I think it will never get any doubts in your minds that that's an additional tool to work with the trauma. This is not the panacea, it's not a religion which will allow us to solve all the issues, but still we need to have in the toolkit of psychotherapeutic and just therapeutic tools an additional factor which could help us. And myths. Well, we already mentioned them. Let us skip that. I would just like to say that we already made a deal, and as of today we'll create the working group in Ukraine. It will be done for the first time, and I invite all of you to join it. Well, of course, not all of you, but the people who are interested in that. This working group will be created attached to the Ministry of Healthcare, with the involvement of all of the necessary regulatory and patient organizations and NGOs to create the first steps and to draw a roadmap for the implementation of this task. And I also believe, as it was mentioned by Oleg, and I was asked today already, that the speed of the decision-making during the war needs to be colossal, and it inspires. I would say that though this awful factor has become a catalyst, but it's a unique opportunity to make it quicker with fewer losses to achieve better outcome. I mean, looking at the time line of the implementation of PAT in Ukraine. And my dear friends, I'm not saying thank you for the attention within this awful full-scale invasion which is still going on. Those are our coordinates, you know all of them. This is what will happen. I thank you, everyone, and I congratulate you. So I feel that I'm totally happy with today. I thank you that all of you have made it possible, everybody who's been involved, and I think that we have huge perspectives, so we will prevail. Glory to Ukraine, glory to the heroes. Thank you so much, Ksenia. And of course, I had kind of a hint about any question, but after the slogan, which is written there, no questions are needed. You answered all the questions with this slide. Dear friends, we thank you that you were present here today. The only thing I'd like to add, I really would like that, Ksenia, thank you for your activity, and I would like to thank all of the workers and staff of the Rehabilitation Center of Lisova Polyana for your work, Forest Glade for your work. You're doing something incredible. And it's really touching and inspiring. We thank you and all the servicemen. What can we do now? As we started this discussion, and it was mentioned that we need education, education, and education again, we need to begin disseminating it. We need to initiate various pushes and promotions in the social networks, at least to post, at least to share. We will make all the videos, we'll voice over them, and we'll disseminate them gradually for the population to be aware and to understand what is taking place. I thank you so much and see you soon.